Good afternoon. It is 1:30 and I'm calling to order this first in the series of budget hearings for the Board of Supervisors, Monday, June 12th, with an evening session to follow at 6:30 p.m. if necessary. Let's begin with a roll call, please. Hi, Curtis.
Supervisor Arenas?
Here.
Supervisor Chavez?
Here.
Supervisor Simidian? Vice President Lee?
Good afternoon, President.
President Elmbert?
I am here. Supervisor Arenas is going to lead us in the Pledge of Allegiance today. Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Item 3 is public comment. This is the portion of the agenda set aside for members of the public wishing to address the Board of Supervisors on matters not on today's agenda, but within the purview of the board. Curtis, do we have speakers either in chambers or on Zoom?
We currently have 5 speakers in chambers, and looks like we're getting a few hands on Zoom. It's
Okay,
like
so
2
let me
right
just
now.
make 2 notes then. To folks who are in chambers, if you're intending to speak, please fill out a yellow card now. The queue for in-chamber speakers will close when the first live speaker begins speaking. And for those of you who are on Zoom, we'll do the same thing. The queue will remain open until the first Zoom speaker begins, and then it will close. And both of these directions are for purposes of meeting management and time management. So what is our total right now?
Looks like we're holding steady at 9.
Holding steady at 9. All right, then we are in the 2-minute range. So let's begin with the speakers in person for 2 minutes each, Curtis.
All right, I'm going to call out all 5 speakers. Please line up. We have Susan Lilly, Sarah Giannocaro, Linda Heil, Charlene Mahabali, and Pho Bui. You can line up and please approach the microphone.
Okay. Good afternoon. I'm Susan Lilly. I am from District 7, homeowner and proud occupational therapist. I've been a therapist since 1986. In my 38 years, I've been a union steward, a supervisor, lost my job code, been work furloughed, and even went out on strike. Despite all this, I stayed because I believe in the community care for all. VMC trains new therapists. Once trained, however, they leave, they go somewhere else. This lack of staff retention is concerning. The experienced staff are the ones that provide patient care for all our specialty units. Our nationally ranked hospital for rehab has to limit the number of bed admissions because we have staffing shortages. This results in lost rehab revenue for the county. And the wait list for the outpatients, it's ridiculous. The insured can go elsewhere, but the underserved cannot. They only have us, VMC. By the time we see them, they've developed more serious problems because treatment was delayed. Did you know VMC has been named the #1 rehab hospital in all of California? Us, the county. It's not Stanford, not UCSF, not even Kaiser, but us, Valley Medical Center. We need staff retention to keep that legacy. We need staffing to keep experienced therapists and stay #1. Thank you for your time.
Hi, I'm Sarah Giannocaro, a District 1 homeowner. I was born and raised in San Jose, and for the last 17 years, I've worked as an occupational therapist for the Santa Clara County Office of Education. Unfortunately, I'm one of Susan's examples. In 2000, I spent the first 6 months of my career as an intern at Santa Clara Valley Medical Center and California Children's Services, and my mom is a retiree of 30 years from CCS. Many of my students receive school services through COE and healthcare and therapy services through the county. I'm here in support of staffing up and not deleting vacant positions. Vacant Vacant positions mean programs are understaffed, and simply eliminating the code does not make a program fully staffed. With less staff, patients and residents suffer, whether that is through longer wait times or no access to necessary services. One of my one-year-old babies with a rare syndrome needs a vision test. Her mom has called Valley Health 3 times attempting to make an appointment, and because her daughter has a breathing tube, each time she's been told someone will call her back. Yet she's not received a return call during the last month. Eliminating vacant positions is not the solution. The county must invest in staff and compensate workers so they can afford to live in the community where they work. A 2/3 vacancy rate in behavioral health and county communications is unacceptable. Deleting 253 positions in health and hospital and 64 positions in behavioral health will substantially impact residents' abilities to access necessary physical and mental health care. If my families and my neighbors can't get an appointment now, can you imagine how much worse it will be when the county attempts to provide ongoing services with 1/3 of the necessary staff? The solutions are simple. The county must actually utilize the $500 to $700 million of unspent dollars in the budget each year to provide services and invest in workers. The county must prioritize investments in services through competitive, livable salaries, workforce training, and career opportunities, partnering with workers in the community to address the staffing crisis and to recruit and retain instead of deleting vacant positions, which hurts the ability to serve Santa Clara County residents. Santa Clara County can prioritize the health and safety of our children and seniors, and Santa Clara County can implement comprehensive solutions to combat the staffing crisis. Thank you.
Hi, my name is Linda Hill. I'm a psychiatric social worker at Elmwood. At a time when the number of mentally ill coming into custody keeps getting higher, and the nature of their mental illness keeps getting worse, the number of PSWs and MFTs left to care for them are getting fewer. We are currently 17 codes short. We only have 14 crisis PSWs and MFTs for both jails, which house about 3,000 inmates. At Elmwood, I constantly work by myself because we don't have staff. There are shifts that are almost empty. At this time, the county wants to cut two codes for MFTs and PSWs and give them to nursing. That is after, for years, the county has been paying nursing staff more than 2 times the hazard pay that they pay PSWs and MFT. So is the county saying that the life of a nurse is worth than that of a mental health professional? The few of us left behind, we are constantly burnt out. I think that the county shouldn't cut our codes. Rather, the county should pay PSWs and MFTs better to prevent us from living in search of better paying jobs. And this will also recruit new MFTs and PSWs to come to the county. Thank you.
Sorry. My name is Charlene Mahabali. I'm a marriage and family therapist at the main jail. I work into the building right next to you, the building that people often ignore. For bad reasons, we end up in the news all the time. Recently, there was 3 completed suicide within 3 weeks, which is a lot for us. And there was 2 officers that were stabbed. I saw that client a couple weeks prior, and I go home thinking, that could have been me. During COVID, we were not able to work from home. We were often denied PPE from medical staff. We were told we were not worthy of PPE and seeing people without masks. When will the BOS and the county start respecting the clinicians that work in the building that no one sees how many people we actually keep alive, how many people we give skills to integrate back into the community? When will the county recognize that when we go home, we stare at the walls for hours just trying to decompress from our day, from hearing everybody's traumatic stories? When will the county start supporting the jail workers and the clinicians as a whole? We have 17 vacant codes that we have not been able to fill because people do not want to work in a place as such. We have 62% vacancies county-wide. There is a national mental health crisis, and in the state of California, it's even worse. When will you acknowledge us? Do more people need to die? Do more people need to quit? I hope not, and I hope the county addresses these vacancies and retention issues for the clinicians countywide. Thank you.
Good afternoon. Thank you, supervisors and the executives. My name is Fobui. I'm a chief steward for SEIU 521 and a psychiatric social worker 1 for 18 years with the behavioral health department. I am requesting the Board of Supervisors to do a deep dive into the department's proposal of deleting up to 53 frontline codes that are providing vital direct services to our community. These potential codes that are going to be deleted can potentially help generate revenue for the department through CalAIM billing. The department's proposal of adding numerous SEMA codes is not the solution to solving the ongoing vacancy, staffing crisis, and staffing retention. I urge the Board of Supervisors to reconsider the department's proposal. Thank you.
So that concludes our in-person public comment. We currently have 6 individuals with their hands raised in Zoom.
Great. I will make the last reminder again that the Zoom queue will close when the first person begins speaking. With 6 and 5, we're at 11, so we are still at 2 minutes. We'll begin when you're ready, Curtis.
All right. Our first speaker from our Zoom queue is Assistant Chief Ashley. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak.
Can you guys hear me?
We can hear you.
Okay. My name is Ashley, and I'm a janitor at VMC and also an SEIU 521 member. Us county workers are 100% committed in fulfilling the vacancies that are hurting our communities we serve. I am joining SEIU 521 co-workers in taking part of a ULP strike vote this week. We are ready to take steps in protecting our county safety nets and securing comprehensive solutions in order to protect and serve the large community and county that is consistently buying new facilities, but yet they are not supplying enough staff members to fill these facilities. Safety concerns is a detrimental to the county and the patient and communities and the workers that serve everybody else. Santa Clara County can prioritize safety by fulfilling all the vacancies. Thank you.
Thank you. Our next speaker is Alex Lesniak. Alex, I am unmuting you. Please accept the unmute. You will have 2 minutes to speak. Alex, are you there?
Me? Hello?
Please go ahead.
Thank you. And I also want to thank my colleagues who spoke before me. I'm here today at the Board of Supervisors as both a local resident of this county in District 4 and as a chief steward for SEIU and DFCS. Other speakers here have already articulated how balancing the structural budget deficit through deleting vacant codes will negatively impact service provision. So I'm going to focus on another budgetary impacted area that's receiving a little bit less attention. So as the board may or may not know, in late November 2022, the new COO and CEO announced yet another new shift in telework policy from the return to work countywide policy implemented in July of 2021. The actual result of these new changes impacts those departments and agencies that have chosen to effectively embrace telework and is forcing them to radically reduce telework to pre-pandemic limitations. As the county is home to Silicon Valley, and as our duty as a public agency to serve the public interest, I am left confused as to this unilateral decision. For those whose presence is required at work, traffic has returned to a nightmare. Air quality in our county is less than desirable. No cost savings analysis has been presented to us or our labor partners, as well as the financial aspect of telework for our community and the very real probable loss of institutional knowledge and skill set if telework is to be allowed to be scaled back and or denied altogether, as we've seen. I'm asking the supervisors to help challenge and encourage those telework reluctant executive management to embrace this quote new normal, end quote, and to grow with it, not battle against it. Let's remain accessible and competitive to best meet our community's needs. Thank you so much for your time.
Thank you. Our next speaker is Linda Nguyen. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak.
My name is Linda Nguyen. I am a psychiatric social worker too, working in the crisis team at Main Jail in Elmwood. I previously worked in community mental health in LA County for 3 years, and the differences are stark. In LA County, management was not so top heavy. Although we were also short staffed, there was enough support for management to spread our workload. Our managers cared about our livelihoods and had ongoing discussions to support advancing our careers. In contrast, I currently risk my life daily working at the jails. I have to worry about clients possibly attacking me, especially as I walk into a building that states no hostage area. That means my life will not be negotiated if I am placed in a dangerous situation with a client. We are threatened, spat on, and have feces or urine thrown on us more often than not. What will the Board of Supervisors do to recognize the clinicians that work in such a hostile environment? We are here to serve the community, but not to be abused. Thank you.
Thank you. Our next speaker is Kimberly Sanders. I am unmuting you. Please accept the unmute. You have 2 minutes to speak.
Hello, can you hear me?
We can hear you.
Hello, my name is Kimberly Sanders. I'm an LMFT2, and I've been working at the county jail for approximately 7 years now. I also want to add that I am currently 7 months pregnant, and I'm here to talk about the safety and hazardous situations that as mental health clinicians go into working in this jail, in this facility. And many of my colleagues have already spoken to the deficits that we have as far as staffing. And that puts a strain on clinicians like myself having to work by myself, having to go into units. And oftentimes we go into units without officers' assistance at times to the cell doors. And it is hazardous and unsafe. But as my colleague mentioned earlier, our hazard pay is incredibly lower than those of nurses, and we are seeing patients just like they are, if not more, in contact at times when there are crises. And I just want to say, I hope the county does take into thought that maybe if you increase pay, it might help keep retention of these clinicians as we can work other places that are not so hazardous. Thank you.
Thank you. Our next speaker is Stephanie. I'm unmuting you. Please accept that unmute, and you will have 2 minutes to speak.
Yes, hi, can you hear me?
We can hear you.
Okay, so my name is Stephanie Ventura. I am also a licensed marriage and family therapist too. I've been working with the Elmwood and Main Jail facilities for the past 4 years. I decided to come to Custody Health Services 4 years ago because I had a wonderful experience 10 years before that working at the Santa Cruz County Jail. We had enough staff and fewer clients in the jail to see, and so there wasn't as much level of burnout. And one thing that I noticed working there and within the community of Santa Cruz at the time is we were able to make an impact on recidivism, which also made this job satisfaction better. So I think when I came to Santa Cruz County, I wasn't sure what to expect. I thought it would be even better than that previous experience at Santa Cruz because it was a bigger county. It seemed like it had more resources, more opportunities. But I'm noticing that it's not as great. The staffing is creating such crazy burnout. And I think that when I think about an impact in our community of Santa Clara County, I feel very limited because my job, I have to focus fully on crisis every single day. That anyone and everyone that is going back to the community sooner, they just don't have access to any of us. And so my question to the Board of Supervisors is, what is the value of mental health worth? Because you have us workers that are willing and ready to do the job to really create an impact in our community, but with so few of us, and with pay that's lower than these other partners that we have in other counties, it's just not retainable. And so that's my question for the board is, what is the value of mental health? Thank you.
Thank you. Our next speaker is Alyssa Granata. Please accept the unmute. You will have 2 minutes to speak.
Hello, everyone. My name is Alyssa Granata. I am also an LMFT2 and have been with the county for 3 years. I do just want to say thank you to my colleagues in person and on Zoom who have expressed these concerns to the board today, taking the time today. This is a really important issue that we are constantly fighting for. So I started with the county as an MFT1, and I've stayed because I really love working with this community, this population. And I'm proud to work as a clinician for the county. However, it has been really difficult to stay, as been mentioned before, because my peers work in clinic settings that don't have to deal with the dynamic of a custody setting, and they also get paid more. I love helping the clients that I work with here in the jail, but at times, or more often than not, I am burnt out from the constant profanity, yelling, and sexual harassment and getting spat on that happens with us when we meet with our clients. It's difficult to show up some days not knowing what I'll be walking into. As mentioned earlier, there have been recent events, including 2 officers that were stabbed by clients that receive mental health services. Who knows who else could have been injured? It could have been one of us. And that's a scary thing to walk into every day. My question to the board is, how will the county compensate us working in a no hostage facility? Thank you.
And that concludes public comment.
Thank you very much. Item 4 is the beginning of our hearings, the beginning of the substantive portion, the overview and updated information. But before we hear the item, I want to look to County Council for some guidance. Does the board take a roll call vote on every item where the language says refer item for final consideration and approval on June 15th? Or do we do a single motion at the end of the day?
The board has discretion to organize the vote in a few different ways. The practice the last few years was that the board president kind of chunked items in categories. The board could do it by department, the board could do it by item, the board could do it at the end of the day. The only important thing is that public comment for those relevant, whatever the set of items happens to be, occur before the vote for that set.
Thank you very much. Then, as planned, what I'm going to do, colleagues, is divide the meeting into 3 sections today. The overview includes items 4 through 7. FGOC includes items 8 through 32. And the health and hospital system includes items 33 to 43. At the top of each section, I'll go down the line and ask which items you'd like to hear individually for comments or questions, and then we'll take a single vote to approve all items in that section, whether they're heard verbally or not. I'll take public comment at the end of each of today's 3 sections, so that would be following items 7, 32, and 43. The first overview section includes the memo on June revisions, the Harvey Rose recommendations, requests for information, and approval of tabulations. My own request, colleagues, is that we hear the overview in item 4, and then I'm interested in commenting on item 6G. So Supervisor Lee, happy to start with you amongst 4 through 7. We're now hearing 4 and 6G thus far.
Thank you, President Lundberg. For item number 6, would like to hear 6B for boy, C, 6E, 6F, 6H, and 6L.
B, C, E, F, H, L.
Correct.
Thank you very much. Supervisor Simonian, would you like to pull any from 4 through 7?
Could I pass for the moment and ask that you return in a minute, Madam Chair?
Supervisor Chavez?
Thank you. I'm very interested in hearing item 5 overall.
Okay.
And then on item 6, I have to say that I don't have any right now. I think Otto pulled mine, but I may, as we get to 6. Let me also just make sure I didn't skip anything. Thank you.
Supervisor Arenas?
I'm going to add 6G. I think Supervisor Lee pulled 6H, correct?
Correct.
Okay, and then the 6P, please.
B. Okay, so that's B, G, and H. Supervisor Simidian?
And then let me just clarify, Madam Chair, you're going to go through what item number on this first batch?
4, 5, 6, and 7.
Thank you. Then I have nothing additional. Thank you.
All right. Supervisor Chavez?
Thank you. And I, did you auto pull 6B or D?
Not D, but,
B for boy.
Okay, then that was mine as well.
so D, you'd like to add D?
No, I'm sorry. I just wanted to confirm. I couldn't hear if it was
okay.
B or D, and I wanted to make sure about that one.
Okay,
And I think that's it for me, too.
okay.
Thank you.
Sure, so to recap, we're going to hear 4, 5, and then 6B as in boy, C as in cookie, E, F, G as in girl, H, and L. If that didn't sound right to anybody, let me know. And if we're all good, Greg, I'll turn to you for item 4.
I'm
Correct?
going to start with a couple of comments.
Absolutely.
As the board knows, just for the public's input, we had a recommended budget that was delivered to the public and the board on May 1st. And we had workshops about that recommended budget in the middle of May. And we heard discussion from the board about priorities. What we've done now is we've gone back to the drawing board, reassessed revenue and expenditures, updated the revenue projections and expenditure projections based on accounting period 10. And we have developed this revised recommended budget, which is to be added upon the May budget. You remember we started with a projected deficit in the $140 million range, which meant we had to do one of 4 things or a combination of those. We either had to cut funded positions that were vacant, meaning that we did not degrade services, or the alternative was to cut funded positions, which would cause layoffs. This was not desirable for many reasons, so we did not include that. We could have also recommended cutting services, again, not recommended because that's unacceptable to reduce services to our community. And then the 4th option is to find ways to increase revenue or use revenue more efficiently. We focused on, therefore, reducing unfilled funded positions and on being more creative with the use of revenue and maximizing its flexibility. So you'll see that in some areas we've recommended substituting special fund revenues for general fund revenues, and we've also recommended using more of special funds and grant funding. Each department has reviewed all of their recommendations. At this point, are in agreement with them. We have looked at the position counts again since May and changed them around so that you have a different list of vacant funded positions because we've tried to maximize the utilization of grant-funded positions and make sure that we only focus on reductions in the general fund. This is going to be the easiest year of reductions for the next 5 or 6 years. Next year will be significantly worse, and the year after that considerably worse, because we anticipate general revenues to be decreasing, and we also know that state funding and federal funding, as well as property tax, will not be increasing at a rate commensurate with our expenditures. So we have a balanced budget for you to consider. However, about 40 million of it is using one-time funds, which will not be there next year, which means that will cause a deficit next year. We still have a structural imbalance, meaning that our expenditures are higher than our revenue and our anticipated revenue, and we'll have to work on this vigorously over the next 3 to 5 years. So with that, I'll turn it over to Greg, who can go through the details, and will be available for questions, myself and James and Greta, and obviously Greg.
Good afternoon, President Ellenberg, members of the board. This is Greg Ituria, County Budget Director. And last month in May at the workshops, we provided a detailed review of the recommended budget. In today's presentation, I will provide a concise review of the recommended adjustments and some important context as we enter into the budget hearing. Next slide, please. The recommended budget was balanced in a way that partially addresses the structural budget deficit while also addressing the board's priorities. Because the budget proposal that was issued on May 1st was balanced, all subsequent adjustments need to be balanced adjustments as well, including those contained in your packet that we'll be reviewing throughout today and tomorrow. Next slide, please. Since the costs for current staffing and services exceeds the county's revenues, the recommended budget proposes to delete many funded vacant positions to balance the budget. The revised recommendations presented in this hearing provide alternative position deletions in some cases, compared to those that were published on May 1st. About 600 vacancies are recommended for deletion to help address the structural budget deficit. Next slide, please. Inflationary pressures have caused the county's recurring expenditures to exceed recurring revenue. The budget published on May 1st relied on more than $41 million in one-time solutions to fund ongoing costs. The revised recommendations rely on an additional $16 million in one-time solutions to fund ongoing costs. The remaining structural deficit as we enter the next fiscal year starts at about $57 million and is projected to grow to an estimated $158 million by the end of next fiscal year. Next slide, please. Addressing the structural deficit will be difficult and multifaceted, requiring action, prioritization, and redirection of resources to focus on the most essential services. Next slide, please. The recommended budget published May 1st was reviewed by the board and public in workshops last month. In this hearing, the budget will receive updated information and updated recommendations, and we will end the hearing this Thursday by adopting a budget for the fiscal year commencing July 1st. Next slide, please. New information since the May 1st publication is detailed in the agenda packet and comprise of updated revenue estimates, adjustments due to recent board actions, and a revised estimate for the general fund ending fund balance available for use in the next fiscal year. Next slide, please. Revised recommendations are agendized for individual consideration by the board this afternoon and tomorrow, based on the board's discussion at the workshop, department input, and the aforementioned new information. Next slide, please. Additional adjustments include concurrence with $19.7 million in budgetary savings identified by the management auditor. The total of all adjustments add a net general fund cost of about $17.8 million. Next slide, please. To rebalance the budget and to accommodate the board's inventory of proposals, a number of further adjustments are proposed, including a reduction in capital project funding, eliminating nearly all remaining general fund reserves, and updating the general fund contingency to equal the board's funding policy for it at 5%. Next slide, please. A summary of the adjustments is presented in this slide for the general fund, but a detailed breakdown of all the adjustments is provided in your agenda packet. Next slide, please. Revenues are still expected to grow in the year and years ahead, but not as fast as recent years. Costs have been and are expected to continue to grow quite a bit faster than revenue, especially for the cost of labor and other service and supply costs that are sensitive to inflationary factors. Next slide, please. While the recommended budget is technically balanced, it is not structurally balanced, and there are many threats that may make the projected deficit worse than the administration's forecast, such as a worsening economy, adverse federal or state action, and very little remaining fiscal flexibility. Next slide, please. As ongoing costs continue to grow faster than revenue growth, the county will have to take significant actions in the next budget cycle to balance the fiscal year 24-25 budget that starts in just a little over a year. This concludes the overview of adjustments and context as we enter into the budget hearing, and we're available for any questions the board may have.
Thank you very much. Are there questions on item 4? Supervisor Lee?
Thank you. Just real quick, Greg, regarding the some of the discussion you have regarding capital improvement funds, could you tell us which of those capital improvement funds do you think will be impacted with this?
Yes, I can pull to it in the packet. For the most part, they are projects where there is still the opportunity to do some design work in the next fiscal year, with the thought that the timing of the project is such that the funding for construction would not be needed until the following fiscal year. So there's some deferment of funding. And just with the understanding that with such a choice, if the board chooses to agree with that, that does mean that in the following fiscal year, there'll be a request for construction portion of those particular projects.
Thank you, Rick. And then the other question I have is regarding our reserves. The slides talks about eliminating some reserve. Actually, what you're doing is not eliminating it. You're just basically putting it into the contingency reserve. So basically, still in the reserve. It's just on a different name, right?
Yeah, the two different parts. Of course, the general fund contingency can be used for any purpose, and the adjustment to that is to comply with the board policy target of 5%. And because the adjustments do include increased revenue estimates, there's that factor that comes into play. And the proposal to eliminate the other reserves were a little more earmarked, but obviously by reducing those to zero, you want to have any remaining for those particular earmarks. Roughly, it is nearly the same amount. But that's coincidental, not necessarily purposeful.
But if I could just clarify something, the board has a policy on the amount of the contingency reserve, which is a calculation amount, and so I don't think it would be a fair characterization to say we're increasing the contingency. It's just being maintained at that calculated amount. It's not being augmented beyond the calculated amount.
Was that 5% you're talking about, right, James?
It's 5%. It's a net 5%, so it's actually far less than 5% of the entire general fund.
Right. In terms of cash management, since this money is a reserve that's sitting there, are we able to collect some good interest off on a day-to-day basis? Because obviously interest rates are way higher now than a couple of years ago.
Yeah, it certainly does factor into the cash. I mean, there is a difference between fund balance and cash balance, but by having a contingency reserve of that nature, it does mean that we end up having a higher cash balance as a result of that. Those cash balances have been declining. But fortunately, I guess to your point, because the interest rate is higher, we're earning more, even though we may have less cash, we're earning more on that cash from a rate perspective. And in this recommended budget for next year, our forecast is for a total increase in the estimated interest earnings from cash in the general fund.
Great. Thank you very much. That's all I have.
Supervisor Chavez.
Thank you, and thank you for those questions. I have a broad question that really relates more to the timing of the budget. One of the comments that you made during the overall presentation, Greg, was that in order to address the structural deficit, that's a body of work that would begin really, I know, on July 1st, as you're thinking about the coming year. My question is, what is the framework or approach that you anticipate as an office taking, and how does that approach differ from perhaps what we just experienced? And specifically what I'm interested in is the question around, from a structural deficit perspective, you would be looking at, prioritizing, I'm sure, salaries and some other key, budget pressures. And what are they, and how would you engage the departments, the unions, the leadership of the organization, and really thinking those through? Because we even today still have questions about under what circumstances, we should or shouldn't be removing a particular position. And what I'm really concerned about is how that happens relative to the board's priorities, particularly around behavioral health, as an example.
I think I'll try to answer that, Supervisor. Multiple approaches to trying to deal with ongoing structural deficit. Number one, after the board takes action this month, or this week, I should say, we will look at the natural changes in the number of positions that we have. People continue to retire, leave for whatever reason, and those vacancies will be looked at carefully to see if they need to be replaced. The departments will be involved in that, obviously, and they'll make recommendations about that. The other issue is that we will continue to monitor our anticipated revenues and our actual revenues. One of the things that the board and the public oftentimes don't pay much attention to is that we do finalize an adopted budget that comes out in September, November time period, at which point we've looked at all of the revenues and all of the expenditures throughout the entire fiscal year and corrected anything that needs to be corrected. It's no substantial change from what you will approve, but it does involve looking at ongoing revenue and expenditures, and that will give us a target for us to work with the departments on reduction plans. The reduction plans that we like to focus on are operational savings rather than personnel savings. We certainly want to avoid any layoffs that we can avoid. And so we look at making the operations more efficient. At the same time, there's lots changing in all the departments, particularly in behavioral health, social services, and medical health. Changing revenue projections, changing around the way things are being formulated at the state and the federal level, changes in our rates at various locations. We'll keep an eye on that to make sure that we maximize our revenue and minimize any effect on operations. Given that, we anticipate that sometime in the end of the year, into the calendar year, we'll be asking departments to formally present reduction targets in order to address whatever remaining structural deficit we have, and we will proceed through the normal budget process next year with lots of challenges that I'm leaving off to James.
So let me, colleagues, just share a thought that I think would be valuable for the full board to consider, and that is that I think if we concur that we have a structural deficit, that one of the most important discussions I think that we have as a board is what we think about the plan relative to how you address the structural deficit. And I thought the point that Dr. Smith, although you were a supervisor at one point, that Dr. Smith raised about, what types of positions get considered for reduction, what types of positions do we want to maintain, and are there areas that we want to recognize that we're just going to have a tougher time recruiting, but we need those positions to stay open. I'm just going to use an example, and it's partly why I pulled item 5, because I want to talk about County Comm and TSS. All that is to say that I think that a structural deficit, how that gets addressed should not be, or should be really laid out to the board even prior to departments getting their targets, because I think that's got to be informed by the board reaffirming its priorities, A, and B, us having a more deep discussion about the areas where we think that where we recognize there are opportunities for changes in the way we do business. I just want to give one example. Dr. Smith, some time ago, I was asking a question about how, really understanding better the finances of the hospital. And I thought one of the points you raised that was so important, and it's really changed the way I've been thinking about the investments even in this budget, was you were talking about what happens when we see a patient in wearing our hats in primary care versus on the emergent side of the aisle. What's the rate of return to the organization, and how does that keep the overall health and hospital system vibrant and alive? And it made me think a lot about the investments that some that are part of the what you're bringing forward as adjustments, one of them being working with our nonprofit partners to make sure people keep those appointments, and that those appointments further get the kind of services that that particular patient needs. And it started me thinking a lot about when we're investing in, Action X, how does that weigh in for the overall budget? And I think that discussion, rather than having it at the end of the budget process, we should really be having it at the beginning of the budget process, which is really the fall, so that we all can weigh in, but also give buy-in to the approaches that are taken, and frankly, even be able to respond better to our employees who are asking questions about why is this action being taken versus that action. So that's really a recommendation, President, to you in terms of agendizing that kind of discussion in the fall, so that we all go in with open eyes in terms of the budget deficit.
Supervisor, on the third day of the budget hearings, the last item is kind of reflections on what went well, what we need to do, and I would love for you to re-raise that so it gets to be part of the formal direction for iteration next year.
Perfect.
I think it's
And those
an
are all my
outstanding
questions.
idea.
Yeah,
Thank you.
you.
Any other comments on item 4? If not, we'll go to item 5. And again, for review, we're going to hear B as in boy, C as in cookie, E, F, G as in girl, H, L, and P as in peanut butter. I sure do. So disregard all of that. We're going to item 5. I had written it in the wrong margin there. Item 5 first. I'm not going to say that list again. You'll have to remember.
Let's do it.
President Ellenberg and members of the board. Yeah, item 5 is the recommendations related to the Harvey M. Rose Associates review of the recommended budget and administration's reply. I see that the management auditor, Cheryl Solov's joining us. So perhaps the board's interested in just asking some general questions and going from there, or if you'd like a particular presentation. And we don't have any slides for this one.
Oh, okay. Supervisor Chavez, then Smidian?
Thank you.
Unless
And
you had
I
yours.
pulled this off at, because
Sorry, it's 1 second. I'm getting a side eye from Joe.
Oh, you are?
Did you have your
I'm
light
used
on
to them.
first?
I'm just kidding.
Did you want to speak first?
Just trying to follow the ping pong ball as it bounces back and forth, Madam President. All
You
well.
good?
All's good. Yeah.
Okay. So thank you. I wanted to, first of all, say thank you for the report and appreciate that there's a significant overlap in agreement between both parties. So that's very helpful. What I wanted to better understand is on packet page 59, and it looks like it's page one, well, I'm actually not sure because of the way this is structured, but there's a chart on here that says budget revenue for internal charges for informational technology services across all county departments. And what I was interested in understanding is that you all highlight the uncollected revenue. And I wanted to better understand the implications of that because I didn't understand if that was primarily general fund dollars or if it were other dollars that we were leaving on the table based on the assessment that Harvey Rose did.
Good afternoon. Thank you for the question. Those are internal dollars that are uncollected. So they come from the various payors of the services. And in this case, the recommendation was about the hospital systems. It's the hospital systems payment.
So what I'm trying to understand is the implications of that, given that they're internal. So if they're internal and they rely on general funds, then that's moving money from one fund to another. Not a bad thing, but it's moving funds from one fund to another. If it's money that we could be billing an insurance company or somebody else, that's really what I'm trying to understand, so I understand the implications of these numbers, which seem significant to me.
And so in this case, it would be effectively general fund money because of the general fund operating subsidy.
But if it's general, I mean, it has an impact on the general fund. Is this something that could be funded through other resources if we were billing properly? Or do you not know the answer to that?
So the charges are set up essentially by the internal department. So in this case, TSS calculates its expenses and then it bills the other departments for payment of its expenses.
I
So that's
understand
what
that.
this is, where they're not actually, they're budgeting this, but they're not actually using that service as budgeted.
So they're not, the service is being provided and being unpaid, or the service is not being provided and therefore there's revenue left in departments that haven't paid this?
I believe that probably what is most likely causing the funds to not be used is either they're overestimated for the cost of the services or the services are not being delivered as planned.
It's a combination of issues, exactly as Cheryl said. At the beginning of the year, right now, we estimate what those costs will be, but then through the years, through the period of the year, expenditures actually change based on projects being delayed or based on new projects coming up or based on new efforts that cost less than was expected. So it's just like any other part of the budget, it's a estimate, and so when there's reserves left, they show up in the fund balance. I put up the comparison of the auditor's proposals and administration proposals just for some easier analysis.
Yeah,
of
that's
what
super
they are.
helpful, and I'll get to that next. I mean, I have two more questions before I come to that one, but one, the only reason I was highlighting this is that I actually think it's important to understand the answer to the question that I just asked, and I did see that in the staff report, there's, it appears to be budgeted unused funds, but it also had another contention, a line or two above, about not actually not making charges. So really what I would like to ask is that, and I'm not sure if this is the right way to understand this, but I would actually be very interested in understanding whether or not a majority of the issue is the work is just not being done for any number of reasons, which, by the way, I think when it comes to TSS, there's a lot of reasons those projects get slowed down. So this isn't a judgment thing. It really is more of a question of does TSS have the appropriate budgeting tools, billing tools it needs, and therefore, does that mean it could have an impact on other places where we could be drawing in non-general fund dollars? That's really what I want to understand from this. And I would just ask that we get that as a follow-up, in the fall, so that we know the answer to that question. And if it could go on the, I think this would really go under your committee, Otto, yeah, that just to take a look at it would be helpful. And especially, I think, if we're looking at, a structural deficit of 158 million, and this is, looks like it's 24 million just in this one bucket, that's actually pretty helpful to know.
Yeah, we'll be happy to do that. I should also point out that for last fiscal year, 22-23, there were a number of TSS projects that we eliminated, put on hold, or just outright abandoned because we looked at the portfolio and realized that some significant projects were going to be inconsistent with new technology, and so we eliminated those. So it is a little bit higher, unused revenue, bit higher this year than it was last year.
Right. Well, last year, yeah, I see what, and I'm actually looking at those numbers as well, and I appreciate the point you're raising. And again, I just think, with TSS, the other thing is the projects are large and they're expensive, and it's such an important part of the family. So I don't want to lessen it. I just want to make sure it's refined enough that we've got the appropriate level of investment. And frankly, that if there are projects that need to carry investment, I know this is an area Harvey Rose has been critical in the past, but I'm not as critical about that as long as we know what the project is, what the timeline is, and how much money we're reserving over a number of years to get the project done, so that it's just much, much more clear. But again, if we're going to be looking at $158 million deficit next year, I'm really going to be looking this year to see where we can further refine that. And then just two other questions about this. And actually maybe I will go right to this slide. I'm curious for you, from Harvey Rose, if you wouldn't mind, Cheryl, if there are any of those areas that you think we ought to be taking another look at to determine whether or not there's more revenue available to the general fund, I'd be interested in hearing that from you, especially now. So you put your report forward, the staff had a chance to look at it, they've agreed with this. Is there anything here that you say, yeah, but this is one other area I really want to encourage the board or two to re-examine?
You're speaking of just the revenues?
Well, I'm speaking specifically if there's an area of disagreement that you want to make sure you highlight. Or are you feeling pretty comfortable with the fact, the feedback you got from them, and this seems like an appropriate amount to you?
I'm sorry, I'm just, I guess what I would say is that we still think that our recommendations are valid, even the ones that they have, not agreed to.
Got it. Thank you, Cheryl.
No side eyes, Madam Chair. Colleagues, the challenge every year on these is, do we want to haggle it out on each one of 17 items, which is a daunting task. But to return to Supervisor Chavez's query, I actually would be prepared to make a couple of motions if, and just depends on whether or not there are board members who agree or support the motions. The easy one is that there are, I believe, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 items where there is concurrence. So we could simply move to accept the concurrence, call it a nice day, and then I would go on to the remaining 7, and I have a recommendation as to those 7, and we'll see if there's support for that. So with the forbearance of the vice chair, move acceptance on the concurrence, if that's an appropriate motion at this time, on the 10 items. For the record, they are items 1, 2, 4, 5, 6, 7, 8, and 10.
Yes, I think that's
And
acceptable.
13 and 14, forgive me, I apologize.
Right, yeah. And okay, so motion by Simonian, seconded by Chavez. Sorry, go ahead.
Forgive me, I hurried and then I missed 2 anyway. They are items 1, 2, 4, 5, 6, 7, 8, 10, 13, and 14. And it is my understanding, Ms. Soloff and Dr. Smith et al., that there is concurrence on those recommendations. Yes, that the administration has responded that it concurs with the recommendation.
Yes.
Yes.
So not to be flip, but I'm prepared to take yes for an answer. So
Yes.
Well, I'm hearing a lot of yeses, so I think that's a good thing. In terms of agreement, just what does motion
Should we
basically
call
of
a
concurrence?
roll?
Yes, we can go ahead and call a roll on this one. Any additional comments, Dr. Smith?
I'll get to the others in a moment, Mr.
Yeah,
Chair.
when he gets to the others, I'll have comments.
Okay, very good. All right, so let's go and take the vote.
Supervisor Rennes,
Yes.
Supervisor Chavez,
Yes.
Supervisor Smidian,
Yes.
Vice President Lee,
Yes as well.
President Ellenberg stepped away.
We'll take a vote when she returns. Thanks.
And through the chair, if I may, colleagues, on the remaining items, I have reviewed these items, as I'm sure we all have, and I understand if people have different points of view, but on items 3 and 9, 3 being risk management, 9 being fleet services, there is partial agreement. And on item 11 and 12, the administration has disagreed. Then when you get to 15, 16, and 17, all of which, the last 3 that I just referenced, 15, 16, 17, they're all Valley Medical. And I am inclined, and in fact will, just see if we get traction, I would move acceptance of the administration's position on items 3, 9, 11, and 12. And not to put too fine a point on it, basically I am agreeing with where the administration landed on those, a couple of which were partial, a couple were disagree. In a minute, well, I will fold into the same motion just in case we can do it all. And I will actually say that I want us to take the recommended action on 15, 16, and 17, all of which deal with Valley Medical, that has been recommended by the Rose organization. I don't know if that was clear or not, but basically agree with administration on 3, 9, 10, and 11, and agree with the Rose organization on 15, 16, and 17. Dr. Smith, that's my motion. I would note to your question, Supervisor Chavez, Ms. Solov, if I am looking at the numbers correctly, on items 15, 16, and 17, all of which deal with the VMC situation, that would result in something like $19 million in budgeted savings, understanding that that's different than how it all turns out. And my thinking, colleagues, after, in a minute I'll let Ms. Solov answer, is that these are also all issues at the VMC that could be revisited mid-year. And if it turned out the greater need was there, then the greater need was there. But if not, not. And meanwhile, we're able to book those savings. And I'm just persuaded by the Rose Organization's analysis on those three in a way I was not on the prior four. Ms. Salt, does my estimate of 19 million sound about right on those three items?
Yes.
Thank you. So again, the motion is concur with administration on 3, 9, 11, and 12, concur with Rose on 15, 16, and 17.
President Ellenberg, can we please put that matrix back on?
Yeah, I've got it.
Everybody else can follow with us.
Yes, thank you.
Whenever you let me talk, I'll be happy to talk.
Thank you. Let me go through the supervisors so you can address everyone.
I've got
Once,
it.
do you want to?
There we go.
What the
Okay,
matrix
thank you.
does not show is that on 3 and 9, there is partial concurrence, as I understand it.
Yeah, it's the difference between 4,900,000 and 5 million on 3, and the difference between 3.8 million and 3 million on the difference.
And
With
on
9.
11 and 12, the administration disagrees, as I understand it.
Correct.
And if it would be easier, Madam Chair, I could make the motion in two parts. The first part would be to concur with administration on 3, 9, 11, and 12.
Let's do that.
And if there's a second,
I'll second that.
then we could take a vote on that. And then in a minute, I think everybody's figured it out, I would be moving to concur with Harvey Rose on 15, 16, and 17. That will be a separate motion, which would, of course, get its own result.
All right, so we should vote, we're going to vote just on this piece, the concurrence, and is there an action attached to that?
Yeah, the action of concurrence basically means that we accept the recommended budget language, as I understand it, Mr. Aturia and Dr. Smith, because it would not involve any further change.
Right, if you agree with the administration recommendation, you can vote, obviously, and that will signal a concurrence.
It is essentially an acceptance of the status quo recommendation before us on those four items.
Right.
And Madam Chair and colleagues, I did not mean to preclude questions or people poking into any of these. I just thought it might be helpful to have a motion on the floor so that if people want to pull stuff out or probe on a particular one, they have.
Tell me the numbers once more that we're concurring on.
3, 9, 11, and 12. And 3 is risk management, 9 is fleet services, 11 is the TSS, VMC, and 12 is the facilities.
Okay. So we have a motion and a second. Do we have any questions or comments from supervisors just on this motion, on concurrence with 3, 9, 11, and 12? James, I said at the top of this section that we would hear public comment at the end of 4, 5, 6, and 7. If we take a vote now, does that impact the hearing
Yes,
of
you need
public
to hear
comment?
public comment prior to any vote on an item.
Right.
You should put the vote on the item
And
off.
one approach that you could take is to take public comment in advance of chunks, if you'd like. Then in the event that there is a motion in the middle of
Good
a
tip.
conversation, that won't be an issue.
Let me do that.
Okay. Which we haven't done. So let us rescue me now, please.
You could ask if there's
Should
any
we-
public comment on any of these items, I think you said through item 7 for this chunk.
Oh, we want to do all of that right now, not just on item
You might
4.
as well, I
Okay,
think.
Fine. All right, then we are going to pause with a motion and a second on the table, and we're going to go to public comment. And to those of you who are listening from the public, apologies for the flopping around here, but we are now calling for public comment on items 4, 5, 6, and 7,
Excuse me.
after we hear from Dr. Smith.
I think you should just say you're getting comment on everything from 1 to 14 because you already made a motion on those others and didn't get public comment on those others. So
I think
nobody's
she's referring to the agenda items, not the Harvey Rose Matrix items.
Correct.
The public comment is for agenda items through item 7.
Incorporating and inclusive of all of the sub-items in item 5.
Which would include everything on the Harvey Rose Matrix.
I have one speaker in chambers for item number 4. I do not currently see any speakers on Zoom.
Okay, again, so 4, 5, 6, and 7. Now is the time to comment. One speaker may have 2 minutes. I will drag this out for just an extra second or two in case there's someone else in the chambers who wants to speak on items 4 through 7. And for those of you on Zoom, items 4 through 7 are ripe for public comment right now. We'll keep that queue open until the first Zoom speaker, if any, begins. Thank you, Curtis, and thank you, James, for organizing me.
All right, our in-person speaker is Dr. Ken Horowitz.
Thank you. Good afternoon. Ken Horowitz. I'm with the Health Advisory Commission, and I was here in May to talk to you during the workshop. And your Health Advisory Commission, which I'm the vice chair, made up of 11 dedicated people through the 5 districts, have been looking at healthcare over the last 2 years, particularly reducing healthcare costs, especially due to chronic diseases. In your public packet tonight, our proposal is listed there and our recommendations. And I came before you in May to ask you to put aside $50,000 so we can train some current staff at Valley Medical Center in integrative and functional medicine. We believe, our commission does, that the cost of chronic disease is going out of control, and as you can see from the budget, we have problems going forward. And so we wanted to propose that you put aside approximately $50,000, and it could be split into $25,000 for the next 2 years. But this is a recommendation that we'd like to see the county executive, Dr. Smith and Mr. Williams, put in item number 4, in agenda item number 4. We believe our Health Advisory Commission is that currently we don't have what we call evidence-based medicine. What we have is reimbursement evidence based on what insurance companies pay. And we feel that by training primary physicians in this category will be cost saving. Thank you.
Moving on to our Zoom speakers.
Thank you. Do we have speakers on Zoom?
We have 2 speakers.
Excellent. Again, when the first speaker starts speaking, the Zoom queue will close, so we'll give you another second or two to raise hands, and then we'll go to the first speaker.
All right, our first speaker is Mike Rogers. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak.
I would like to voice support for the Health Advisory Commission recommendation to set aside $50,000, as Dr. Horowitz just mentioned, for integrated functional medicine training for physicians and health professionals already in the county health systems. That in our discussions with the county health system, that's the model they've been looking at as we started a discovery process towards defining the pilot as voted on in the December Health and Hospitals meeting per the Health Advisory Commission recommendation. Setting aside $50K and a nearly $4 billion over county health system budget enables the county to jumpstart the needed training while the pilot is still being defined in 2023, shortening the time when these services could be available to the most diverse and less affluent demographics of our county who suffer metabolic chronic health conditions at higher rates. Fundamentally, this is a key equity issue as some level of integrated functional medicine services are available in many other major health systems in the county and in the Bay Area, including PAMP, Suter, Stanford, Kaiser, the VA hospital, and UCSF. This is also fundamentally a long-term economic viability issue for our hospitals and our healthcare system. 75 to 90% of the total U.S. health costs today are currently consumed treating the major chronic metabolic diseases. And these are all progressive diseases that have increasing health costs over time for an individual. These diseases are all increasing faster than we can forecast them and alarmingly accelerating as well in pediatrics, where some of these diseases never existed before. Functional and integrative medicine addresses the root causes of these metabolic diseases and does so in cost-effective ways. If we change the trajectories of health outcomes for individuals with chronic diseases, especially pediatrics, this has a major impact on the livelihood and the health outcomes for our population, as well as for our budget for providing health care as a stopgap system for our county. Getting this started sooner rather than later in the county health system is essential to providing for the most diverse, less affluent, and most affected by chronic diseases demographic.
Thank you. Our next speaker is Kira Kazantzis. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak.
Hello, this is Kira Kazantzis from Silicon Valley Council of Nonprofits. I'm speaking to item 6C. I wanted to say a couple words about nonprofit organizations that contract with the county and kind of their position this year, which is kind of similar to the position that was in that our organizations were in last year. We're in as you all know, a heightened cost scenario. Last year, we were very pleased to have a productive conversation with the administration about how we could address those contract needs with both an across the board cost of doing increase, which was very modest and approached did not quite get to addressing the entire cost of doing business increase we were seeing out in the market, but it went a long way. And it also, the plan last year also had a very flexible approach, which met the county's need to make sure that contractors were performing their contracts, that they were spending their contracts, and also addressing individualized need of contractors. We hope to see the same this year. We're engaged in a productive dialogue with county leadership at the moment. Very much appreciate Supervisor Lee for asking the question that he asked or about the status of these potential increases, and wanted to just make sure that we expressed our interest in seeing this kind of approach as well this year. We think it makes lots of sense. It helps county partners do their role in a way where we're not kind of losing money every single year. And I think, the COVID has really shown the importance of this partnership, and we hope to see it continue. Thank you very much.
Thank you. That concludes public comment.
Thank you very much. We are back to our motion within item 5 on a motion by Simidian to concur with the recommendations in items 3, 9, 11, and 12. Are there additional comments on that specific motion? If not, Curtis, let's take a vote on that motion.
Yeah, this is the one I was referring to. You're basically concurring with administration on everything except 15, 16, and 17, because you already voted on the others. I just think for clarity's sake, it should be, stated that it's everything except 15, 16, and 17 for now.
I will look to Supervisor Simidian to see if he wants to amend his motion.
I think my motion is fine the way it stands, and I think it's even finer with that helpful explanation.
Fair enough.
All right, are we ready to vote on this little piece? All right, Curtis.
Supervisor Arenas?
Yes.
Supervisor Chavez?
Yes.
Supervisor Simidian?
Yes.
Vice President Lee?
Aye.
President Ellenberg?
Yes.
Passes unanimously.
All right, Supervisor Simidian, did you want to make a motion on 15, 16, and 17?
Sure. On these 3 items, 15, 16, and 17, colleagues, Valley Medical Center, Valley Medical Center, Valley Medical Center, I think I agree with the recommendation from the Rose Organization, and so I would move that we direct the administration in the final budget to adopt, accept, implement those three sets of recommendations. And if there's a second, I will say why.
You have a second from Chavez.
Thank you. As I mentioned, and I think you've confirmed, Ms. Soloff, these are items that, the three of them, you would project savings totaling something like $19 million as a budgeted matter, yes?
Yes.
Thank you. And colleagues, as I mentioned a while ago, these are also areas where if expenditures were necessarily higher, I think we could revisit that at the mid-year budget. And I think the other thing I would say is that, item 15, Ms. Soloff, please, don't let me put words in your mouth, but essentially the administration started out asking for a $15 million appropriation for miscellaneous expenses, although I think actual spending had not exceeded $3.2 million for the last few years, annually for the last few years. You proposed a more modest appropriation of $10 million with a $5 million savings to the general fund. Do I have that right so far?
Yes.
And then it gets a little more complicated because I think this is one, yes, where the administration partially concurs. They, I believe, have acknowledged that the miscellaneous expense item is likely to be lower than $10 million, but are concerned that spending in other areas would be higher. So then they asked for a $5 million reduction in the budget for miscellaneous expenses, but with a corresponding increase of $3 million for medical professional fees and $2 million for contract employee services. Ms. Soloff, do I have that right as well?
Yes.
All right. So I'm basically, I think given the concerns about cost increases at VMC, I think it makes sense to see if we could slow the growth of contract staff. And as I said, if VMC needs extra funding, I think mid-year would be the appropriate time to raise that concern. On item 16, Ms. Soloff, if I'm tracking correctly, there's a potential for $7.4 million in budgeted savings because this would be a reduction in the allocation for services and supplies and a corresponding reduction in the need for a general fund subsidy or investment. My understanding is that the administration's asking for an $18.4 million increase in the appropriation for services and supplies, which is a 33% increase, I think, compared to last year. And you proposed a more modest increase, which would save the general fund $7.4 million. Is that summarize it more or less correctly?
I believe so. I'm having some trouble hearing you.
My apologies. And again, this is an area, there you go. This is an area where mid-year adjustments, if necessary, could be made, in my view. And then the third and final one was item 17, Valley Medical selected new positions. And this is one where the administration disagreed. The administration is asking to fund 42 new positions at a course of $8.4 million. And your position, Harvey Rose, as I understand it, is that 32 of these 42 positions should not be approved because budgetary capacity already exists to fill those roles without additional allocation. Did I get that right?
Yes.
Thank you. And again, this is an area where if we needed to revisit mid-year, I think the capacity is there to do it. So my motion, again, was simply to direct administration to implement the recommended actions from the Rose Organization for items 15, 16, and 17. And that still stands. And I know we have a second, but that was for purposes of discussion. I don't know if that's a...
Yeah, I'm good.
Thanks.
Dr. Smith?
Yeah, let me start with the administration's perspective, starting at the bottom with number 17. Compared to the administration's recommendation, this would require us to eliminate another 32 positions at VMC, and we think 650 plus eliminated positions countywide is enough to balance the budget, and that 32 more reductions would cause great disruption at VMC because we're trying to expand and hire, as was mentioned. The idea of cutting another 32 is unnecessary, so we disagree with that. And
Point of order through the chair. Could I confirm whether through Ms. Solif, is it cutting positions that already exist, or is it a request to add new positions?
These are recommended new positions in the budget.
I think that's very different. And I just want to clarify that for the record, Dr. Smith. Thank you.
it's actually not really different because these are unfilled funded positions that we and BMC think are necessary. So if you don't create the positions and you don't fund them, they won't be able to be filled.
Through the chair, point of personal privilege, I don't think that's what we're hearing. I don't know which it is, but I don't think that's what we're hearing from the Rose Organization.
Yeah, these are proposed new positions in the budget. These are not existing positions. These are, as Dr. Smith just said, they would need to be created.
All right, I think the lack of concurrence on that is apparent. Thank you, Madam Chair. Thank you, Dr. Smith.
And then for 15 and 16, I'll show the spreadsheet and turn it over to Greg Aturia.
Okay. For items number 15 and items number 16 are similar in nature as Supervisor Subcommittee noted. There is partial concurrence with these proposals. Looking at the specific line item that was identified in the management auditor's report, that based on recent spending, the amount for that particular line item could be reduced in each of these by the amounts suggested. The reason why there's partial concurrence is that there are other line items at that same object level where we see that the spending trend is significantly higher than what's budgeted at that level. And the point here, whether or not it was successfully communicated, I'll ask, but the point here is the administration believes that the total amount budgeted for services and supplies is the amount needed to maintain current service levels and based on current spending. So just to clarify on that overall, based on current spending, unless there's a reduction in spending or services, we think the bottom line at the object level is the right amount. And then one other clarification, if I may, on item number 17. It is in the recommended budget, there's two sides of what was entered related to these new positions that are proposed in the recommended budget. One is the cost for new positions. And in those entries, we also had an offsetting increase in patient revenue earnings that we believe they would earn. And so the entries, the proposals are kind of balanced, or they are balanced on both sides. So the thought is if we were going to, if the board wanted to approve adding these referenced 32 positions, that we also would want to estimate the amount of patient revenue earnings that they would earn, and that was built into the recommended budget too as a balanced entry. So if the board wanted to consider, let's not add those 32 positions, we would ask then a reconsideration of the revenue estimates and reduce the patient revenue estimates by a commensurate amount, because we want to have the projected staffing to earn those revenues, because that was a presumption that if you had the positions, they'd perform, and then there would be a recovery of those costs through fee revenue. So that would just be a consideration that staff would ask of the board if there's a desire not to add these positions.
Madam Chair, just want to make sure everybody over there is. Madam Chair, I think if the seconder is amenable, one path forward would be to pull item 17 out from the motion. That would leave us with items 15 and 16. Defer action on item 17 until tomorrow, when, as a standalone item that would be continued, we could get clarity about new positions versus existing positions, and we could also ask for the information about backing out the revenue generation, if any, that is associated with the positions. So I will, with the consent of the seconder, if there's no objection, amend the motion in that way, and then I have just one more word I would like to say on this subject.
Go ahead.
Thank you. And one more word is this. I have observed now that I think this is my 11th budget. There's always a little friction around this conversation. So, of course, I just jumped right in. You know, what I would say to the administration is, you know, if we're concurring with 14 out of 17, I wouldn't let that get you scratchy. You know, Ms. Soliv, what I would say to you and your colleagues at the Rose Organization is, I appreciate this exercise every year because your organization brings a sort of an outside set of eyes with expertise that allows us to be more probing in our analysis of the budget, and I think that's to the good. So motion now would be the Rose recommendations on 15 and 16, defer 17 till tomorrow with the requested information to come back. And I would just say there will, of course, be revenue generation, but given the growing level of subsidy/investment, it's getting harder and harder to make the case that these positions pay for themselves. Doesn't mean they may not be wonderful positions and important, but I don't want to be unduly rosy in my expectations about revenue. Thank you.
Thank you. Supervisor Lee, did you want to comment on this specific motion?
I was going to make that suggestion. That's been made, so I have no more to add. Thank you.
All right. Supervisor Arenas?
Yes, I wanted to figure out if tomorrow when we talk about item 17, will administration return with, I know we already have a list of positions on packet page 73, whether to deny or approve due to excess capacity. But it doesn't say what the actual capacity is. So if we could delineate that a little bit better tomorrow, and that way we know what that impact will be.
Could I ask, could you repeat that? I'm sorry, I didn't understand.
Sure. So there's a list of new positions on packet page 73, and there's a job description there, total projection amount, and then it has a column that says deny approval due to excess capacity. And so there's an X that indicates that we should deny the approval due to excess capacity. But I don't know what the capacity is, or how. So, for example, there's a hospital services assistant number 2. I don't know how many hospital services assistant number 2s there are, so I don't know what the impact would be, and I don't know where this assistant number 2 would go to, under what hospital. So I'd like to understand where these positions are going, where the positions are going to be, or originally assigned to, and what is the capacity, or what is the number of hospital services assistants in that particular hospital, that we can actually make that decision, and we can assess there's enough or not enough of that classification.
I understand now.
Okay.
I'll get you that.
Great, thank you.
And just for clarity, that table comes from the Harvey Rose report, so they made some analysis saying deny due to excess capacity. That conclusion was a Harvey Rose conclusion.
Yes, and I'd just like for us to add to that for tomorrow's conversation.
I think we have 16 also that Greg was going to go through.
Please.
Okay, I covered that in principle, and I covered 15. The nature is the same in that the particular general ledger account that's identified in the report is one where we do think there's adequate budget, but there are other general ledger accounts in the same object that we believe where the spending is trending much higher than the amount. So it makes sense to reduce one, add it to the other, but the bottom line object funding would be the same. That's the reason why there's a partial concurrence. And of course, that's up to the board to decide what to do with that.
Dr. Smith.
One more comment, which won't be appreciated. Part of the positions of the 32 was to fill spaces needed at the North County Clinic, so you should just know that.
All righty. We're going to take a vote on Supervisor Simidian's second motion, which is to continue item 17 to tomorrow. And can you clarify for me, Supervisor, what you're recommending with 15 and 16?
Yes, thank you, Madam Chair. You've captured it precisely. Items 15 and 16, supporting the Rose position and directing staff to implement it with a report back tomorrow on item 17, as has been now discussed.
Thank you very much. So I think with that, we will vote on that motion, which will wrap up item 5.
Supervisor Arenas.
Yes.
Supervisor Chavez. Yes. Supervisor Simidian.
Yes.
Vice President Lee.
Yes.
President Ellenberg.
Yes.
Passes unanimously.
All right, we're moving to item 6. I suggested I wasn't going to read the list again, but I will for clarity for anyone who perhaps is just joining us. Under item 6, we are going to hear B for boy, C for cookie, E, F, G for girl, H, L, and P for peanut butter. So let's begin with 6B. And if the supervisor or supervisors who requested a particular letter will pop your lights on, I will know to come to you first. And to those of you who requested B, do you want a presentation or do you want to go right to your questions?
I'm okay for the questions, yeah.
All right.
Oh, sorry, you want a presentation? Okay, sorry, go ahead.
Absolutely fine. So Greg, looking to you for a presentation on 6B.
Okay, 6B is a report in your package that is a response to questions that were brought up during the May budget workshop relating to position allocations and reductions in vacant positions to address the structural deficit. And included in that report are a number of charts and tables with quite a bit of data, including the data that was requested by the board. And that concludes the presentation.
Thank you. Supervisor Lee?
I have a clarification questions. The report states that the recommended deletions referring to the nurses here will not decrease the number of nurses that can be hired next year, and therefore they will not impact services. I would just like to ask if administration can explain how these deletions will not decrease the number of nurses that could be hired next year.
Yeah, through the board president, it has to do with the significant number of vacant positions in these codes, and taking a look at the hiring trends and the amount of candidates that the marketplace has been able to produce and is forecasted to be able to produce. So even with the recommended adjustments and overall funding of positions, it is believed that the remaining funded vacant positions is enough to accommodate what the marketplace can produce in the fiscal year ahead.
And if the follow-up question would be, if let's say we suddenly have a huge burst of applications and the ESA is suddenly moving much faster than it used to, and that these positions get filled, would you come back to us to let us know that you need more vacancies, I mean, more positions? We could readjust and open those positions up in the future?
Yes, I think everyone would be happy to share the news of the great success at the same time.
Great. Okay, thank you.
Other questions on B?
I just have one kind of major question, and this major, I'm sorry, I have had coffee. So on packet page 94, there's a section that talks about county communications, and what I wanted to better understand from this explanation is it says that we're deleting county communications positions, and then it lists out, which I think is really helpful, the remaining vacancies. What I'm having a difficult time understanding is in an environment where we have forced overtime, as we do in this area, why would we delete any positions if our objective is still to hire robustly for these positions?
Yeah, through the board president, if I may, the marketplace conditions it's a similar situation that we're seeing with a number of hard-to-fill classifications such as nurses, and based on the projected what the marketplace can produce, we still foresee that the remaining vacant positions for dispatching positions is more than adequate to accommodate what would probably be generated out of the the labor market for these classifications. And of course, if that changes in similar tone, you'll be happy to come back and say well, there's great success.
Yeah,
if
I mean,
that helps.
I'm with the wild success point there, but what I'm worried about, honestly, is that if in fact and I know we have vacancies across the county, I know our staff is working really hard to fill those vacancies, but there are some areas where we are really digging ourselves into a hole, and in part, what's significantly different about county comm than nursing, and I'm still not entirely comfortable with the response, but what's really significant to me is how small the department is relative to, for example, the health and hospital system. So again, what I'm really trying to better understand is if we take actions for departments where we know we have a chronic problem, like overtime, then the implications of that are that they have to go back through a process competing with the organization overall to reestablish these positions. And so I'm concerned that even our internal process impedes our ability to focus. And not to put too fine a point on it, because I do, I had a really good discussion with Mr. Mills about the actions being taken. There do seem to be some departments that we need to double down on, and this feels like one of them to me. And in part because it's been such a challenged department for so many years.
I think incoming County Executive Williams has a comment, since he's very familiar with the department and the long history of staffing issues.
Yeah, I think the situation with county communications is relatively straightforward, which is leaving 26 dispatching-related vacancies in what is, as you know, a relatively small department. If we had the opportunity to fill all those positions, that would be extraordinary, and it would put us many, many, many orders of magnitude ahead of other large dispatching centers across the United States, and is absolutely the goal. But we don't believe that there will be any impact associated with the reduction in those vacancies, given that through many efforts over many, many years, there's been persistent levels of vacancies in county communications. So leaving, the volume of vacancies there is actually a reflection of us precisely wanting to ensure that there's plenty of vacancies, that there would be no pressure to not take qualified folks in and hire those folks and get them trained and working in county comm, and leaving a very, very, very long runway to do so and to continue to put a lot of resources in towards filling those vacancies. But there's quite a significant volume of vacancies still left, which is exactly why there's unfortunately a continued mandatory overtime situation there. So it's essentially an assessment that there isn't a
solution? We don't have a solution or a plan or a strategy for this area
There
that we
there
think
are
is effective.
strategies and plans. They're not likely to result in 100% of those positions being filled.
So let me just follow up on the second part of that. I'll just say again, colleagues, that I feel like the only time we have a discussion about county comms is when somebody comes to us and says they can't stand to be on overtime one more week of their lives, or during budget. So I'm going to poke at this a little bit more to make an observation. I guess what I am most concerned about is that given the chronic nature of the issue with this particular department, and I think, James, the points that you just raised about we don't feel like we're gonna get there. Two questions I would have. One is, if you know what our strategic plan is to try to hire, that would be interesting for us, I think, as a board, like the changes. Because honestly, the other thing is, every time we hear about this, we hear about changes in pieces, right? The building has to be enlarged. We need a second group that can do more training. There's not enough room in the facility. There aren't enough supervisors. I mean, the list kind of goes on. And so I've actually never seen a comprehensive strategy to address this department. And if that exists, I would love, as a member of the board, to be able to see that and perhaps recommend that Public Safety and Justice Committee get a chance to review that in its entirety.
I think it'd be great for, I know that there were very comprehensive strategies employed many years ago. I haven't been as involved in the last few years, but they were certainly presented at length to FGOC. County Comms Department actually reports to FGOC.
Oh, is that right?
Yes. So I would suggest that the conversation happen there.
If I could add, in fact, when we get to this item actually in the next section, when we're talking about departments, I had direction teed up for information on strategies and reports and outcomes to come quarterly to FGOC.
Yeah, I am. This makes me uncomfortable enough not to feel comfortable about voting on this section. Like that's how detrimental I think county comms the situation is for them. So that's helpful to know. And I'll make sure I take a look at the past reports, because I think it's been years since I've seen something that was comprehensive relative to this department. But this brings me to my second part of the question, and it's a bigger question relative to what happens when positions get deleted. Could you walk through the process by which positions get reestablished if they get deleted?
I can do that. The board on any given Tuesday will see issues on the agenda where they're asking to create a position or do an add delete. And so if we're putting back a position that's previously been removed, it has to come to the board with a recommendation to create the position, which means a change in the salary ordinance and a change in the funding, so that you'll see a salary ordinance and an F-85 attached to a transmittal that explains why the position needs to be created. So,
but Dr. Smith, what I mean to say is I understand the board process. I'm more curious about the internal process and how you determine what comes forward. And the reason I'm asking the question is that in a number of areas, I agree that if we haven't been hiring for a really extended period of time, and maybe that's a circumstance under which you delete a position, but I'm more interested in understanding when a position gets deleted and you have all these competing agencies within the organization asking for staffing, how do they get prioritized to come to the board? And really what I'm trying to understand is, as we take these actions, that'll level set for another stage, then what actually happens behind the scenes before the positions come forward to the board?
well, we get input from the department about efficiency and needs, and then we look at funding to see if they can support the funding. And there's oftentimes a back and forth about what's needed, what's not needed, whether there's additional funding to pay for it before it comes to the board. So it's an administrative decision about setting the priority consistent with the board's stated priorities and consistent with the operational needs. I mean, fundamentally, what we're talking about here is we need to solve a deficit, so we weren't focused on adding positions or filling positions, which would increase the deficit. We're focused on how do we reduce the deficit by making changes in unfilled positions, which by definition are no longer providing a service, and how do we do that in a way that doesn't penalize the filling of other similar positions for the department?
Thank you, and I appreciate that and understand that. What I was really trying to understand is the alignment of under what circumstances positions actually come back, because that has sounded like a challenge for some of the departments, and I'm concerned about that relative to actions that we take. And the other reason is, colleagues, is that it reduces what we think the overall need is too once you remove those positions. I'm not saying there's not a valid reason to do it, but it would be really important, I think, for the board to understand what full, what fully being staffed means and what the implications of that are. And because we do the budget in an incremental fashion, it's a little hard to understand that, which is why I really appreciated the staff report. This was very informative. Thank you.
Thank you. Are there further comments or questions on 6B? If not, oh, Supervisor Lee, sorry.
No problem. I just wanted to have a follow-up with Supervisor Chavez's point, specifically on county communications and how important that really is regarding, we're talking about 911 service. This is the emergency services we're talking about, right?
Can you stay closer to your mic,
sorry, yeah. We're
Supervisor?
talking about the 911 services. This is the most truly emergency services that everybody use for truly urgent matters. I'm one of those people who drive by the highway and see stuff on the debris and whatnot, actually pick up the phone, call 911. And when I have to wait a minute or even sometimes 90 seconds to get a live person and just keep hearing the recording in English and Spanish over and over again, I get very nervous because that means we're not getting to the emergencies as they really need to be. And the proposal here is to delete 11 positions, which does not look good, but when you look at it, what's really bad is the fact that we currently have 38 vacancies, right? That really is a problem. It's not so much we're deleting, it's the 38, and how are we going to hire, so even after deleting 11, how are we going to hire those 27 ASAP? That is really what we need to be focusing on. I just want to make that very clear. And so, number one, I will vote for it today, but what I want to make very sure is that what exactly are we doing, James, since you're taking this over? How are we going to do extra to make sure those 27 positions truly get filled, number one, and then when we actually are fortunate enough to get those filled, that we could actually consider how we could add those 11 back. But in the meantime, I really think that the focus we need to do is how can we speed up the process of getting people hired. Thank you.
Supervisor Arenas?
Thank you. We just finished talking about 42 positions, 42 new positions that we're going to further discuss tomorrow, and now we're talking about positions that we are going to delete because they're vacant. And so to me, it's this catch-up game, and the conversation seems to be a bit circular. I don't know how to assess whether the positions that we just talked about in the item before this one are related to any of the items that we're seeing under this item, if there's any relationship there. And so I think there's already a motion on the floor, correct?
There's no motion on the floor.
I'll make a motion to move this item. And then for us to better understand, since we still have the items from tomorrow on item 17, if we could figure out whether any of the ones that are being deleted today, if there's new positions being proposed under the item for 17 tomorrow. Does that make sense?
Supervisor, I can seek clarifications. This is an informational report. Are you?
Yeah, but these are positions that are being they're going to be deleted because they're vacant, correct?
Well, each
Throughout this process.
Right. So under each specific department,
Right.
this is a summary table of actions that are embedded in the
Right.
various agenda items throughout the rest of the hearings associated
Well,
with each department.
that's a lot of cross-referencing for us to do. And since this has already been done by administration, I'm guessing that it won't be very much. I think for the items that we saw under item 17, there were of course a lot of hospital-related positions, and I think for here, number 5 is 70 FTE positions included for deletion are within the nursing series. So I'd like to see if any of those positions are the same as the new positions that are being proposed for tomorrow's discussion. If there's any cross-reference there. Is it a nurse number 3? Is it a nurse number 4? I don't know. If it's a continuation of any of these positions that are being deleted.
We'll give you some more information.
And proposed through this item, yes, thank you. I think for the rest of them, I don't think they're related, but only for that item. And maybe for the behavioral health services as well. I'm not sure if I can't remember, there was a long list under item 17. And maybe behavioral health would be one of those. So one of the things that I'm wondering is, how are we proposing, because I know that a lot of these vacancies, a lot of these positions that are vacant now, many of those departments are using these vacancy savings in order to have a lot of the overtime that is needed in order to get the work done. So what is the plan if we don't have these positions available, or these vacancies, positions available? What is the plan to deal with overtime? Is there a reserve,
Actually,
a source of funding, something else that we're going to use?
the only departments that have significant overtime are the 24-hour departments. So that's basically custody, sheriff, hospital, communication, county comms, and one more that I'm forgetting.
Juvenile hall.
Juvenile hall. So in those situations, we were very careful to make sure that we didn't recommend deletion of positions where there weren't significant numbers of other vacant funded positions, so that we could certainly hire into them. In terms of overtime, we are recommending that we fund overtime with direct allocations, which we would reassess in the mid-year or mid-fall based on needs. We don't like paying overtime, but using basically a slush fund of vacant positions to pay overtime is not a good representation of the budget or expenditures, because it makes it challenging to see and know whether overtime is necessary for the board and for the public and for the administration. It's not very transparent. So we're recommending that as an approach. And the other departments really don't use their vacant positions for overtime. But you can see that in the ones that do, we had a very small recommendation because we want to get back to a model where you can tell where the overtime's being used and how it's being used. We had a recent criticism from the grand jury about previous sheriff's administration utilizing overtime in ways that were inappropriate. And you can't see that if you can't see where the overtime's being spent. And if you just have it as a slush fund for the, incorporated into the vacant positions, you can't see that.
Got it, okay. So it sounds like there'll be a small recommendation for the positions that actually need it, when they need it, and that way we can really see in a more transparent fashion who's using overtime and if they actually need it. So I appreciate that. Thank you.
Thank you all. Seeing no further lights on, we're going to move to item 6C. 6C. And I'll look first to Greg and then to the supervisor that requested C. I believe that was Supervisor Lee.
Okay, and item number 6C is a report response to a question from the earlier last month regarding information on cost of doing business for the county's community-based contract providers, and the information is in the report.
I can probably add a little bit more to that. I think the specific question was raised in a public comment by Kira from Silicon Valley Council of Nonprofits. And for those who were here last year, you might remember that we made the decision along with the council in good communication with them to establish a process that used different cost of doing business approach for different contracts, because as the board knows, some contracts are fully supported by the general fund, some are supported by other sources like Medi-Cal, Medicare, behavioral health, other grants, funding, and various other sources. And some CBOs spend up to the limit of their maximum financial obligation. Others spend far less than that. So we decided to take an individual approach to each contract, look at what was really needed for that particular CBO to continue and expand their services. We got feedback from Kira and others that policy worked well last year, but that there was some concern that a particular department was not following the same policy this year. Most of the departments were, and we're in the process of evaluating and reassessing the department that had problems with compliance with the policy, and so we've communicated with the contracts people there directly. We communicated with them at the beginning of the budget process that we were going to continue with the same process. We promised, I promised Silicon Valley Council of Nonprofits that we'd send another letter and reassess all the ones that were problematic. So the basic answer to the question is we're not changing the policy from last year, which worked well, but we do have some compliance problems on our side that we're going to have to fix.
May I?
Supervisor Lee.
Yeah, thank you, Dr. Smith. I think you anticipated most of the questions I'm coming from regarding the process itself. And my understanding, if correct me if I'm wrong, was that the last year's process applied a 4% increase for for the CBOs, and that this was what we were anticipating that would be repeated for this upcoming year. But I think the feedback we're getting is that it wasn't informed to the departments that there was a 4% increase for this next year. So I just want to make sure, is that clear for what we are telling our nonprofits throughout departments, or has there been some confusion? I think that might be where the confusion came from.
Yeah, I think there was some confusion. Really, it's been one department. I'm not going to throw them under the bus. It was a fair misunderstanding. But the concept of a 4% increase in rates was based on the funding from the general fund. So some of the contracts, we have the ability to increase the rates, and some of them we don't. Like, for example, our medical contracts with the community clinics, their rate is set by state level and, where they get their insurance. But some contracts, particularly the ones that are not programs that the state or the feds have instituted, say the homeless programs, they're funded through the general fund, and they were intended to be a 4% increase. So yes, that's why I said we're going to have to go back over it. We have well over 1,000 contracts doing professional services, and then another 1,000 doing other things. So it's going to take some time, but the commitment is to do what we did last year.
Mm-hmm. Is Greta has something to add? Sorry.
Oh, I was going to just add something, a further detail and consistent with what Dr. Smith shared, that also the way that our contracts are structured matters in terms of what this could look like. So for example, some of our CBO contracts are cost reimbursement based, and if a existing contract, the cost last year didn't come close to the existing MFO and all costs were reimbursed, that's an example of a contract that wouldn't need to be adjusted unless there's a concern on the part of the CBO that their costs might increase up to that maximum financial obligation set forth in the contract this year. So really just a comment overall that some of what doing an appropriate cost of doing business adjustment looks like really varies based on the nature of the reimbursement or other rate-based approach that the contract structure at issue uses.
So, but for these special type of cases, you would say that the general idea of having a 4% increase across the board for the rest of them should be the same as last year, right? I think that's what they're trying to get from us, from the CBOs, as a clarification.
Yeah, the same as last year.
Okay. Is there a way we could maybe an off-agenda report of some sort just to make it clear to everybody, since there's this confusion, if that would be helpful for us and also for CBOs as well?
Yes, we'll get it. Actually, what I was envisioning is a letter to the departments, which we would share with the board and certainly share with the public.
Great. Thank you very much, Dr. Smith. That's all I have.
Thank you very much. Is there anything else on item C? If not, moving to item E.
And item number E is a off-agenda report included in your packet that addresses a request for information from the May hearing, requesting a report of anticipated fund balances factoring in encumbrances for several specified accounts and funds, including special programs, AB 109, 2011 realignment, accumulated capital outlay, and the COVID reserves. And included in the report is a table with the requested information and some supplementary historical information there as well. And happy to assist with any questions the board may have.
Thank you. Supervisor Lee.
On the projected $26.4 million in the ARPA fund reserve, based on the allocation plan approved by the board, just trying to see if there's any way we could more detailed breakdown of this funds.
Yes, we can get a detailed breakdown of the anticipated available amount. Is that right?
Yeah, if you could do that, I certainly appreciate that information. Thank you very much.
would like to clarify on that. The board previously approved general categories for expenditures of ARPA funds. And the board has subsequently approved a lot of specifics. This number of 26 million is the amount that hasn't been allocated yet to the specifics, but we do have a framework from the board about where it should be going and what types of services it's planned to be paid for. And when we have an actual project, we'll be getting it in front of the board to make that allocation with the F-85. But I just want to remind the board that we're not going to do anything different than what you already said.
Okay. Thank you.
Thank you. Supervisor Chavez.
I apologize. Were we on D?
We're on C. E, we're on E.
I'm sorry?
We're on E.
E, okay. So, and I apologize, colleagues, because I didn't pull this off, but they're kind of similar. And so I was curious. First of all, let me just say, having had a chance to read through all of the report backs, I want to just say thank you to the staff. These were really well done. Every year they get better, more informative, more clear. This was just really, really good. On item D and E, I just had a question that I wanted to make sure that I understood. On item D, you do a very good job of outlining what we're getting through FEMA. And then there is a reference to revenues that were received through CARES Act, Provider Relief Funds, and American Rescue Plan funds. And then there's a reference to the Financial Tracking Board, which I think you requested, Supervisor Ellenberg, for follow-up. What I was really trying to understand is that as we look at these, both D and E, and to the point, Dr. Smith, you just raised about a small percentage of money being unallocated, what I still wasn't clear about is from item D, there's a total amount of money anticipated at some point to come back to the county from our attempts at getting, for lack of a better word, getting our money back. Is there a reference to this money and how this money will be used, or are we treating this as one-time money that will come into the board, come into the budget whenever it's received?
Yeah, that's right. This is reimbursements to the general fund that are being sought after from FEMA for expenses that were funded out of the general fund over the last couple of years. And we don't know what year and what amounts would ultimately be awarded, if that's the right word, or reimbursed, allowed to be reimbursed after the various stages of review and audits from the federal government. But when it does, it will come back as a reimbursement to the general fund. And of course, when that arrives, it gets deposited, the board will be notified, et cetera.
Right, but is it, just in terms of how it's being treated, from your eye, these would be, any reimbursements we got back would be one-time in nature in
Yes.
terms of how you consider them as part of
Yes.
the budget?
Right.
That's right.
Okay.
And the money's already been spent on the projects. So
Right.
this is a great example of why counties end up with cash flow problems. Because we're a big county, we can tolerate it, but you can imagine, Mendocino, Modesto, they can't tolerate this much of a cash flow problem. But once we get the money back, we anticipate further audits. Usually FEMA will go through an extensive process before they actually give you the money, and then a 5-year process after they give you the money to make sure that, the money was spent on the right thing. It's a long-term problem.
Yeah, it sounds horrifying, actually.
It is horrifying.
So then to go back to the cost, so for, when you look at what's being expended in that fund or how much money is being sought after, it's over $500 million. But we spent $1.4 billion approximately. And what it says in the staff report you gave us is that the CARES Act, the Provider Relief Funds, American Rescue Act, and other grants make up that other, some portion of that other money. So what I guess I'm really trying to understand, if, to borrow Joe's sidewalk hours, if somebody said, hey, how much did you spend that you're not being reimbursed for? What would the answer to that be?
Well, let me go through it a little bit to try to explain. The FEMA reimbursement is really only for expenditures that were directly related to the disaster and not for things that we would have already spent. So all of the disaster service workers, not every single one, but most of them, those were expenses, those were things that we had already committed to pay for because they were already funded to do their job. The fact that we changed them to a different job doesn't mean FEMA will reimburse them. So that's not counted. And then with regard to the OES money, the same thing is true. That's project related and other specific expenditures that it qualifies for, that are qualified under the rules. And then with regard to the CARES Act, that has to go to particular services in health. And ARPA has the most flexibility because it can go to a lot of different things related to the disaster. But the problem we have is that if you utilize another funding system to pay for something that we think qualifies for FEMA, that means that that project that we applied for refunding from FEMA will be denied. So if we cross-cover by using ARPA money for a FEMA project, FEMA will not reimburse us. So we're stuck trying to work with the general fund and other sources of funding as much as possible.
So the revenue dashboard that you put up shows a deficit of about $300 million, but but part of it doesn't show the full funding back of FEMA on this yet. So anyway, but my point really is just, I think at some point it would be important for us to just have an updated ledger of what we think we won't actually get back and be okay with that. But I think understanding where we are in both expenditures from each source and then what's outstanding, because this actually doesn't align exactly with the staff report. And I think that's because it's probably, well, I don't know why.
Yeah, we've been reluctant to publicize what we think we won't get because that'll encourage them not to give it to us.
Here's what I mean.
But we definitely won't
I don't mean to
get
ask, I don't mean to ask that
1.3
question.
billion.
Here's really what I want to understand is where we are on the path of repayment by funding source. And I understand what I just said because I would never want to let them off the hook. So no, that's not my intent. But I do think that's important. And I think it's important for an entirely different reason, which is we're talking about a structural deficit in the budget. And the fact of the matter is, Jeff, the point you just raised about our ability to act in part was because one, we had a really vibrant health and hospital system, that we were able to add those hospitals. But the other is the really incredible work done by the staff to preserve cash flow meant that where a lot of other people were really struggling across the country, we were able to lean in pretty quickly to respond. And I think that, again, I'm just saying this again to my colleagues as part of a long-term strategy in terms of the roles that counties play in terms of emergencies, which I think we're going to see more of because of climate change. I just want to be mindful that there were some strategies that were put in place that some we're going to want to preserve, others we're going to want to take a look at, in part based on how we were reimbursed or not. I think the point that Dr. Smith raised about us moving staff from one set of strategies to another is a great example of us, not just us, but counties across the country taking leadership in ways that we'll never, ever, ever be fully reimbursed for. And And that meant we weren't providing other services during that time that we also weren't being reimbursed for. And the cost to us is significant and something that should be thought out as we're doing the emergency plans for the future in terms of how we would be more prepared to respond in a way that has a less economically detrimental to us, and also recognizing this was a very long problem. Others are going to be shorter, but equally as intense, potentially, and especially during the recovery phases. So
Right.
that's why I asked. So thank you for the report. It was really good.
We'll give as much information as we can. A lot of it is in process as FEMA sort of changes the rules on us from time to time and changes our representation and changes the issues that they focus on. Thank you.
Thank you. I think we've now handled D and E, and F is the next item. Greg.
Yep. Item number F was a request for information from the board regarding funding for urban forestry programs, sustainability commission, and youth climate initiative. And the report is in your packet, and in case there's any questions on that.
Supervisor Lee.
So first, I want to thank staff for the response on all the elements regarding the Office of Sustainability that's putting forward. And just want to say that for the urban forestry program, certainly really appreciate the addition of the $75,000 one-time funds, and certainly understand there's not the time to explore a significant expansion of this program. I do believe that the work of the Office of Sustainability will grow over time, and would like an update to come back during the mid-year budget review on how the urban forestry program is being managed and any potential staffing need for the new Sustainability Commission. Regarding the Youth Climate Initiative, we understand that the state has actually approved a budget earmark of $2 million to launch a Santa Clara County Youth Climate Initiative. The Office of Sustainability is working with the community partners to develop and launch the initiative with plans for in-school curriculum, workshops, leadership development, and fellowships. And I would like to request an off-agenda memo that includes a timeline on when the funding from the state will be made available, the process and the requirements for receiving the funds from the state, and recommendation for proceeding with a single source and or competitive RFP for this funding. And I certainly would also like to further request that this information be sent to our Senator, Dave Cortese, my predecessor, based on a letter we recently received, as well as to all the community-based organizations that participated in the Office of Sustainability's recent stakeholder meeting on the county's Youth Climate Initiative. Thank you.
Thank you. Anything else on item F? All right, I'm going to G. That was my request to pull. This is the Guaranteed Basic Income pilot. The board directed administration to draw funding for this guaranteed income pilot for reentry clients from the $4 million in the ARPA funds that were directed by the board in November of 2021 for the reentry population. In administration's response in 6G, AB 109 funds instead were recommended to be used for this pilot based on concerns about eligibility and compliance requirements. My team did some research, and there are a plethora of jurisdictions across the state, including Mountain View, Alameda, and Sacramento, and others across the country that are implementing guaranteed income programs using American Rescue Plan Act funds. Additionally, guidance from the UC Berkeley's Belonging Institute and the Harvard Kennedy School recommend the use of ARPA funds for guaranteed income programs. The report from administration expressed concern that American Rescue Plan Act eligibility and compliance requirements could constrain the program's design, but the report didn't provide really any detail or information on what those constraints might be, nor information on an alternate allocation of the ARPA funds planned for the reentry population. So one issue I have is that I'm actually a little bit concerned about the restrictions with the AB that would be inherent in using the AB 109 funds. Those are only intended to serve a subset of the population that has been released under an AB 109 classification. I don't know that that population is necessarily representative of the larger population we may aim to serve. The recommended AB 109 allocation also contemplates only 50 participants in the pilot, which is a significantly smaller pool than was originally envisioned and smaller than the pilots we're running for former foster youth. So what I'd like is when the administration reports to the board at the first meeting in August on the design of the reentry GBI pilot, and just again, I'll emphasize that that design process needs to include law enforcement, community stakeholders, and people with lived experience. I'd like to see either specific documentation regarding confirmed legal restraints regarding the use of ARPA funds for this direct cash payment pilot, or an addition of ARPA funds to ensure that both AB 109 and our other reentry clients can be included in the pilot, and that we can include at least 100 participants. And I'm happy to send any of the citations and research for that if it would help when you go back to the consultant that we've been using for ARPA.
Well, let me explain our thinking process. We asked our consultant who's focused on reimbursement and ARPA whether this would qualify, and they felt strongly that it wouldn't. And I realize there's differences of opinion around the nation about whether it would qualify. But the public safety realignment, which is called AB 109 funds, have loosened their requirements so that it's not anymore just for AB 109 clients. And that's why we have our reentry funded in great part with AB 109 and also part of the probation and sheriff's department. So we know that public safety realignment funds are going to be ongoing unless the state makes a dramatic change. So our recommendation was that we not try to use ARPA funds, particularly since they're one-time funds, and that would mean the pilot would be unfunded after one expenditure. But if we use AB 109, we'd expect to be able to continue the pilot and expand it. But that all being said, it's up to the board, and so we will come back in August with the information
Thank you.
you
So let
asked
me
for.
make a couple of points there, which I appreciate. Number one, I certainly hope that this will be successful, but a pilot is just that. It's a pilot. So I don't think it's necessarily fair to predetermine that we'll continue it, although I very much hope that that's the outcome. The AB 109 resources, if in fact they are just as fungible as ARPA, that's fine, but the overall amount, again, is smaller than the amount that was approved by the board in the referral. It wasn't a pilot for 50 individuals, and it was, I don't know if we said the full 4 million, but that was the pot that it was to come from. So if you're certain that AB 109 is a good piece, then I would recommend adding to it with ARPA funds as directed by the board, as opposed to swapping out. I'm concerned. I hear you about one-time funds and absolutely love the optimism, but we also need to get the ARPA funds out the door, and one-time expenditures do make sense. I haven't heard another allocation recommended for that $4 million that the board did agree to set aside for the reentry population at large in November of 2021. So perhaps that should be included in the report too. If it's not the full 4 million of ARPA funds, what else are the recommendations for that $4 million reentry pot?
Right. We'll get the report back to you.
Okay, perfect. Thank you very much. Anyone else have a comment on G? Seeing none, the next item is H.
And item number H is a report providing information requested by the board relating to the funding plan to enable remote and hybrid commission and committee meetings. And the report is in your packet, if there are any questions.
Thank you. Supervisor Lee.
First, I would just want to thank the clerk of the board for coming up with the mobile conferencing carts being deployed for specifically, in this case, I believe, for the Planning Commission, and that was able to begin doing the remote public participation since May 25th. So I just would like to ask if when we could actually expect to use mobile conferencing carts to be deployed for the other boards and commissions as well. Thank you.
Thank you. Any, Dr. Smith?
The clerk is approaching the dais.
Good morning, Board of Supervisors. Tiffany Lanier, Clerk of the Board. So the equipment has been ordered. It is on order. We're waiting to receive it. As soon as it is received, TSS will build the carts, and we will test them out, train, and then we can implement the remote public participation. We anticipate that it will happen hopefully between now and the end of July. That is our goal, but we're dependent upon when it's delivered. My understanding is TSS says it shouldn't take more than 24 to 48 hours to build the cart, so that's great. And then we'll move forward as described.
Thank you very much.
You're welcome.
Supervisor Arenas.
Thank you. I appreciate that that mobile conferencing cart is in the process of getting here, which I'm assuming this isn't a part of maybe a greater assessment of your office to figure out what it is that you need in order to get hybrid meetings up and going. I looked at the RFI, and it doesn't mention the current workload and challenges to enable remote or hybrid commission and committee meetings. Could you talk a little bit more about that? What are your office challenges?
In terms of office challenges, that's really, I would really say that is mostly staffing. We do have some vacancies that we are recruiting for, interviewing for, trying to fill. So I would say that staffing is the greatest challenge.
How many vacancies do you have currently?
Right now, for our board clerks, we have 3 vacancies.
Okay. And then you're asking for an additional 2, correct?
Yes, correct.
So that would be a total of 5 folks.
Newly hired, yes.
Right. So with the 3 that are vacant, do you think if you had those hired, couldn't those folks meet the current workload and take on as part of their current, or if they were hired on part of just their typical workload?
No, not at this time, because remote public participation is a new practice process for them. And so,
Yeah, I understand.
Yeah, so no, not at this time. It is possible that over time, as we use the system and look for opportunities to streamline what we do, it's possible that we might find, we may not need to, but at this time, yes, 2 people are required. I
would really encourage you to take a look at and make an assessment of how to create those efficiencies before you hire additional people. I saw our board, our city clerk, excuse me, as a city council member switch into that role. It was difficult, but they did do that, and they did that while we were still in sheltered in place. And so I would really encourage you to to take a look at what you have, some of the existing resources, before hiring additional folks. Because I think this is just part of the way that we have switched our workloads, right? I mean, we take on online meetings as well as in-person meetings, and I think this is just a sign of the times. And so we're asking, you've heard us all day talk about some of the deletion of vacancies, and we're talking about some really difficult decisions we need to make. And so we also need to ask folks to take a look at their current workloads and challenges. And if you haven't made that assessment, I would encourage you to do that now before moving forward. So those are my comments. Thank you.
Thank you. Seeing no other comments on this item, item L is next.
Okay. And item L is a report back to this board on a request for information from the budget workshop relating to the CHAC, formerly known as the Community Health Awareness Council, regarding the budget and potential role.
Supervisor Lee, I think L was yours.
I don't think so.
No?
Sorry. No, not me.
Anybody else going once, twice on L? Supervisor Chavez.
Thank you. I actually missed M, so I hope it wasn't me that said L instead of M.
Oh,
So I
well, let's do
apologize.
M, because
Okay.
M was not on the list.
Okay, great. Thank you.
So let's have Greg, if that's all right, just tee up M.
Sure, thank you.
Okay. And item number M is a request for information regarding the plan to support outpatient program implementation, CalAIM payment reform. And there is a report in your packet describing that plan.
Thank you. So first of all, I again wanted to say thank you for this report, and also TSS did a good one. I mean, all of you, I just really appreciate the feedback we're getting. One thing that I wanted to just raise with Dr. Smith and James and I don't know if we have our healthcare staff here, but one of the, oh, I see, Renee. You know, one of the issues that has come to my attention relative to CalAIM is some maybe confusion around how CalAIM can be used to address housing and homelessness in particular. And so one request that I wanted to make of all of you is that there may be value in not just sitting down with the Office of Supportive Housing with us, but with Destination Home and the other players who are part of the overall work that is being done, you know, relative to how CalAIM can be used, because there's some misinformation out there, and I, you know, believe me, I actually forwarded the report to somebody because I thought, oh no, that's not what CalAIM can be used for. But I mentioned this to Dr. Smith today, and I just thought I would mention it to you all and get your thoughts, concerns, or reflections on how we are or aren't bringing together all of our partners in housing in particular.
Yes, good afternoon. Rene Santiago, Director of the County Health System, along with Dr. Sherry Terrell for Behavioral Health. And good afternoon. The question you asked is a pertinent one because there's so many projects and initiatives to CalAIM. Some of them are related to the housing and using housing, not necessarily direct funding for housing, but some of the services wrapped around the housing benefit. And so I think it's an ongoing work that we've been doing with OSH, as well as our CBOs. And as new opportunities are released by the state of California, obviously we need to follow up with our stakeholders here locally to make sure that not only we maximize the revenue, but also identify further opportunities than everything else that you, the board, have done related to the housing issues.
Can I just add a little bit to that?
Please.
Part of the problem with the way CalAIM was envisioned by the state is that they decided to put these responsibilities on the local initiatives, the health plans that are negotiating and entering into contracts directly with the state. So in our county, that means Family Health Plan has this responsibility. And now recently, the governor has allowed all of Kaiser to directly contract with the state. So one presumes Kaiser will be the next provider. And then as part of a two-plan county, Anthem Blue Cross competes with Family Health Plan, so they will have to have a way to do it. None of those three entities have a housing capacity like the county does, but the county is really the delivery system from their perspective. So we're going to have to work with not only the housing advocates, but those three entities to coordinate the services in such a way that we provide not just the housing, but all of the other services that are required, mental health services and social contacts. So it's going to require a big team effort to actually do it right. And, you know, I'm worried about how much Kaiser and Anthem Blue Cross are going to put effort into it, because at this point it's not determined by the state exactly how much you have to do. And, you know, it would be convenient if I was Anthem Blue Cross CEO to say, let the county do it.
I see Renee shaking his head and Sherry. So in order to not have that be the case, what is our plan moving forward? And in particular, let me just say one thing that was a little surprising to me is that I spoke to one of the providers and they are in the process of hiring some new housing staff. And I would rather them not do that. I'd rather them you know, work more closely with us since these are our, I mean, we're sharing patients. Is that something you are already prepared to kind of bring them in and talk to all of them at one time and have a plan that's
Yes, and we do have ongoing work groups at the multiple levels of staffing, of course. In some cases, it involves the CEO. In some cases, it involves the frontline staff. And the dynamic that Dr. Smith identified is a particularly complicated and challenging piece for us because you have been a leader in housing, and we've done probably more than proportionally other counties related to the supply and demand for housing. So I think in this case, the managed care plans are deploying different strategies. Some of them want to contract directly with the CBOs as opposed to going with the county or having the county coordinate those services on their behalf. And I think that just adds to the fragmentation. Some of them use different criteria in terms of the target populations. We consider, obviously, a specific criteria given our tools and methods that we developed over time dealing with homeless populations that have been refined with the Office of Supportive Housing and with your leadership. So I think all these things are barriers and challenges that we have to kind of make our way through it. Now, there are some other initiatives by CalAIM that are available through grants. And so that's probably an opportunity for us to actually go directly to the state and apply for those things. So we have to contemplate a multitude set of strategies and relationships, collaborations with our partners.
Thank you. Dr. Terrell, do you want to add anything?
No, I think Renee has covered our
Thank
efforts
you.
around
I
housing.
know
Thank
Renee
you.
is kind of the master of all finances. So let me just make a very formal request, and that is that our county meet with the leadership of each of the plans to make sure that we understand both their intent, but also, frankly, that we can pitch all of them on working collaboratively through our plan to end homelessness. And to your other point, that there is some shared thinking about the grant opportunities at a state level, because I also recognize we could be competing with these health partners in our own backyard, and that seems like a waste of time and money that I'd like to see us not do. And in addition to involving Destination Home and obviously our Office of supportive housing, I think there would be a lot of value in us making sure we're including the, Preston's shop, the Housing Authority, with us as well. Thank you. Thank you, colleagues.
Thank you. Supervisor Lee.
Yes. A follow-up question is, whether the administration might have a strategy to support providers financially in case there are some significant problems with timely billing and payment as it relates to this payment reform coming up.
Can you say that again?
Sure. Just want to make sure our staff here has developed some type of strategy to support the providers financially in case there are some significant delay and problems when it comes to the billing and payment as relates to this payment reform coming up in CalAIM transition.
Well, I'll speak to that broadly, and then perhaps Renee or Sherry may have something to add. Definitely are aware that the providers have concerns in that area, given the complexity on their end of the equation in transitioning to billing in a pretty different way. And of course, there are some potential challenges on our end as well. But that's definitely something folks have been very focused on. We have to balance the need to make sure we can timely make payments to our providers, which absolutely we're responsible for doing and are committed to doing, while also having a process that allows us to work really smoothly in getting the state funding drawdowns that we use to then make those payments. And so the concern they've identified, which is just, what will we do if sort of all hell breaks loose with that process, is something that all counties across the state are having to stare down as we make this really significant transition. And it's a bit difficult to plan for what could be the wide variety of things that may turn out to be challenging, but behavioral health and HHS Finance, and particularly HHS Finance, who's responsible for that component of the process, are definitely laser focused on that and very attentive to making sure that we're able to make timely payments to our providers who are absolutely counting on that revenue. And so we have certainly the funds to do so and the processes in place to do so, and then a readiness to escalate whatever are the issues that are coming up in those early months as needed for all of us in key leadership roles to then work with the departments to address whatever might be unforeseen obstacles as we're moving through the change.
Yes, Supervisor. I think Supervisor Semedian will remember going through a similar process on the ACA when we're talking to community clinics and moving from grant-based and cost-based to other forms of reimbursement. I think this is one of those areas where your leadership as well as the administration, as long as we're fidelity and alignment to federal state policy, because at the end of the day, they're the ones paying for a lot of the services. We as a county just finished a conversation about our concerns related to the general fund and some of these services putting extraordinary risk on the general fund. I think it's so important for us to align to these federal and state policy and care reforms. So it's working with our partners to make sure they understand why we're doing these things. And of course, making sure that as a managed care plan on the behavioral health side, that we have the network adequacy and access standards met, and bridging any potential gaps here in a manner that still gets us alignment with federal state policy, because again, this is coming from that level, and then ultimately improving the care and access to our patients, because that's really the bottom line for us in terms of our mission, to make sure that not only their financial status is stabilized, but also ultimately that the benefits and the clients actually get the care they need.
Thank you. Seeing no other lights on, item P, Supervisor Arenas' request, and that will wrap up item 6.
Okay, and item P is a report returning to the board with a plan to address the South County, Santa Clara County Fire District operating costs and capital needs for next fiscal year.
Chair, is it okay if I?
Please.
Okay, wonderful. Thank you. So thank you so much for the report, and I'm hopeful that this strategy will be able to cover the costs, some of the capital costs that are coming into the fire district. It's not going to solve for the whole issue, but I know that they need to, for now, cover some of the capital costs. And so I'm hoping that we can, the report was a little unclear in terms of when the fire engine gets purchased and when it gets paid, and when exactly, how exactly, or what exactly gets paid for this first year. And so I'm hoping that administration can return with a detailed update on the finances of the district in a mid-year budget, so that we can see where the fire district will be at that point.
Who would like to
Sure, we
respond
can
to
do that.
Thank you.
Awesome.
Summary is that the $1.5 million for 2 years in a row that was committed to by the board, we are going to take out of the emergency trust fund, the emergency management trust fund, and we have confirmed with the district chief that for the first year, that's consistent with his planned budget expansion. And for the next year, it's very close, within a few tens of thousands of dollars. But obviously, for the next year, we're going to have to work vigorously on trying to find a long-term solution.
I appreciate that. And then I'm going to ask also for an off-agenda report, and this is related to item 6B, when we had the conversation about the vacant positions. And this is just a report on how administration, the plans on how you are all going to manage and account for overtime and the strategies that you discussed when we had that part of the conversation as well. Thank you.
All right, thank you. That wraps up item 6. Item 7 was not requested to be heard. So at this time, do we have an open motion on the floor that you made, Supervisor?
I made one,
Arenas?
yes.
And did someone second it? Please remind me who seconded it.
I will, but do we need to? Aren't these receiving reports?
Item
have to-
7 requires a vote.
Oh, all right, thank you.
To forward on to?
No, item
No?
7 is the adoption of a resolution regarding the estimates and tabulations. It's a state law requirement. So item 7 needs to be included in the motion, requires a vote.
All right, so the motion should be just for item 7 then?
Whatever motion's made needs to include item 7, and item 7 is the only one that legally needs to be adopted.
I'll make the motion to receive the report for item 6 and include item 7. Thank you.
Supervisor Chavez.
I'll second that. I was hesitating a little bit because there's some parts of 6 I'm still feeling uncomfortable with, but I mean, mostly they were reports, so that's fine. Thank you. I'll second.
Thank you. We took comment at the top of this chunk, so let's vote on 4 through 7, please.
Supervisor Arenas.
Yes.
Supervisor Chavez.
Yes.
Supervisor Simidian. Yes. Vice President Lee.
Aye.
President Ellenberg.
Yes.
Passes unanimously.
Thank you very much. Our next chunk is items 8 through 32, which make up the FGOC section of today's agenda. I am going to hear public comment first on all items 8 through 32, but I'll request which items my colleagues would like to hear. I'm interested in pulling items 24 and 25 to be heard together. Those concern county communications. I'm not going to rehash the earlier conversation. I just want to offer direction about the reports and expectations coming to FGOC. So if you'd like down the line to let me know what else between 8 and 32 you'd like to hear.
Could we do that after public comment? To see
Sure.
if there's any, that might rise,
Not a
make rise
problem.
for something. Thank you.
So Supervisor Simidian.
Before we go to public comment, however, because there are a couple of Levine Act items, I don't know if the clerk needs to offer an exhortation, but I know I do, so I'm looking forward to that opportunity in a moment, Madam.
Oh, absolutely, but I don't, hang on just one second. I don't see on my notes from the clerk any Levine Act announcements, which doesn't mean they don't exist, but.
The item numbers, let me just read the announcement since I'm here. Item numbers 12 and 14 are subject to the Levine Act. Any party or their agents and any participant who has a financial interest or their agents must disclose on the record a contribution of more than $250 made to a board member as described on page 3 of the agenda.
Thank you so much. Supervisor Simidian, go right ahead, please.
Thank you, Madam Chair. As just indicated, we have been advised that items 12 and 14 on today's agenda may be subject to the Levine Act, as indicated in the language on our published agenda. We've also been advised that pursuant to state law, any party or their agents must disclose on the record a contribution of more than $250 made to a board member, as described on page 3 of our agenda. So I want to ask at this time that if any party or agent has made such a contribution, that they disclose that contribution immediately so that I may promptly recuse myself. I would also ask that if any participant in these proceedings, as defined by the Levine Act, has made such a contribution, that they disclose that contribution immediately so that I may promptly recuse myself. And I would also ask that if any employee of the County Counsel's office or of the Clerk of the Board's office or any other member of the county staff or any member of the public knows of any reason I should recuse myself under the Levine Act, that they please disclose that information immediately so that I may promptly recuse myself. And finally, Madam President, while it is, of course, a matter of public record, I would like to note that since January 1st, 2023, when Senate Bill 1439 took effect and amended the Levine Act, I have in fact received various campaign contributions, which have, of course, been reported in full as required by law. All such reports are, of course, public, and I would ask that if anyone has any reason to believe that any of those contributions were unlawfully made, that they advise me of that immediately so that I may correct the situation and ensure that contributions that are not permitted are not subsequently given or received. And finally, let me just exhort any and all potential campaign contributors, please make no contribution which violates Senate Bill 1439, the Levine Act, or any other provision of the law. Thank you, Madam Chair. I would, however, ask the clerk and the county council, and I may just be hearing it wrong or interpreting it wrong, but I think the clerk's notice indicates that participants are obliged, and I think they are not obliged, which is why we had the lengthy conversation we had. So while I want to encourage them to identify themselves, I don't think they are, and maybe I'm just hearing it wrong. Could I ask the clerk to repeat the language and maybe look towards the county council meaningfully while you do so?
Any party or their agents and any participant who has a financial interest or their agents must disclose on the record a contribution of more than $250 made.
If I could ask you to stop right there, Mr. Clerk, thank you. Mr. Williams, I don't think the participants are. I thought that was why we were having the lengthy discussion. Under state law, I don't think they are, and they're clearly not under our own county ordinance because of the action we did not take.
Participants are not. I don't know if there was a change since I looked at it back in January, but the notice I recall reviewing in January distinguished between parties and participants and requested that participants disclose.
Great. So perhaps we could just ask through the chair that the county council and the clerk's office talk with one another and, if need be, amend the language. Thank you.
Thank you. Again, I'm going to look down to each of you for requests to hear items between 8 and 32. Supervisor Simidian?
Except I think we had a request from Supervisor Chavez to hear from the public
We
first.
sure did.
My apologies. I took everybody off track with my disclaimer.
Thank you very much. Do we have public speakers?
We have no speakers in chambers, and we currently have no hands raised in Zoom.
All right, just a last notice, since it's a big chunk, items 8 through 32 are ripe for public comment. I see nobody rushing to get a yellow card. You've got nobody adding their virtual hands.
Looks like we have one speaker on Zoom now.
All right. So let's hear that speaker, but I'll note if anybody else is planning to raise your hands, please do so right now, because the short queue will close when the first person begins speaking.
All right, our first speaker is Catherine Hedges. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak.
Good afternoon. Good afternoon. I'm Catherine Hedges, and I'm actually planning to speak tomorrow, but I believe it's probably appropriate now too. I'm from Surge, and our coalition partners, SV Debug and Survivors of the Streets, as well as SEIU 521, are all very concerned about the lack of staffing for behavioral health, social services, and other agencies that provide care for our community. It's impossible to provide the level of care that our community needs when everyone is so short-staffed, overwork leads to burnout. Burnout leads to quitting, and that's the last we need. So I hope that the positions that we need to fill for those departments can be reconsidered. Thank you very much.
That concludes public comment.
Thank you very much. I will now look to my colleagues for request to pull items between 8 and 32. Supervisor Lee.
14I and 26.
14I and 26.
That's all. Thank
Supervisor
you.
Simidian?
None.
Supervisor Chavez? Supervisor Arenas?
Yes, I'm so sorry. I just had it here. Items 14.
All of 14?
Yes, items 14, 15, 26, 27. There we go.
So all of 14, 15, 24, 25, 26, and 27. Did I miss anything from anybody? All right, Greg, back to you, and we'll begin with item 14, which we've just indicated as a Levine Act item. Supervisor Lee requested item I. Supervisor Arenas requested the whole item, so that takes precedence.
Okay. Members of the board, item number 14 is a request to consider the county executive's revised recommendations for the budget for the Office of the County Executive. And there are numerous items for adjustment that are recommended in your packet.
Supervisor Arenas?
Thank you. So for item, I'm not sure which one this is, if it's 14 or 15, but this has to do with our housing, Office of Supportive Housing. And what I'm wondering about is for the added position on the Office of Supported Housing to support the homelessness prevention division, have we considered deploying any of the added staff in full-time or part-time capacities in any of the county buildings or sites located in South County?
I'm sorry, I'm not hearing very well today.
Oh, no problem. What I'm wondering is if OSH is adding support for the homeless prevention division, and I'm wondering if any of that staff is going to be deployed into South County.
Key can give you an answer on that.
Thank you for that question, Supervisor Arenas. Those positions are actually performing some homelessness prevention services currently. They're sort of working with the court to assist people who receive an unlawful detainer action. So this action is really to sustain those positions because they were previously unclassified.
Unclassified?
Yeah.
Okay. So I'm going to move on to, and are any of those in South County?
I don't think so, but I will check, and we can get back to you on how the South County residents access those services.
Perfect, perfect. So I know in future years, we're going to continue funding the added OSH positions through reducing contracts related to the continuum of housing programs. So we're going to provide the same quality of services with as the CBOs with contracts and housing experts in-house. Are we looking at that contract outcomes when we reduce some of these contracts? What are we looking at? How are we just making those decisions?
Sure. I think broadly, our homelessness prevention system, the process by which we identify and reach out to individuals who need assistance with maintaining their housing, and then the process by which we administer the rental assistance and provide some support services for them. All of that is, or most of it is contracted out, and we imagine that it would continue to be because for the most part, individuals have a good relationship with the various community-based organizations. So that will continue.
So there will be no reductions, it sounds like?
Correct. We're hoping to sort of expand it over time through all these various partnerships that we've been talking about.
Okay, but I interrupted you. Go ahead, continue.
Well, I just wanted to say that it's, for the most part, we will continue to contract out those services, and then over the next fiscal year, consolidate and reorganize some of the activities so that the homelessness prevention system is sort of managed and coordinated through the Office of Supportive Housing. But most of the services will be contracted out.
What do you think that ratio would be? What we would do in-house versus what we would contract out?
In terms of the homelessness prevention system, we're talking about a handful of positions to manage the contracts, coordinate the communications, assist with the reporting, so those types of activities.
I see. So this would be more contract management rather than direct service.
That's right. We have a little bit, especially in our partnership with the courts, but most of it's contracted out.
Okay. Wonderful. So I look forward to seeing how we are monitoring the contract and those outcomes so we can create further efficiencies within our system.
Sure. There are a couple reports. One is actually currently produced in partnership with Destination Home. That report is one that we can make sure you have access to. And of course, through our housing, through Hewlett, we provide monthly reports on our, biannual reports on our homelessness prevention system.
Thank you. Those are my questions.
Supervisor Lee.
Thank you. On 14I, regarding the reentry rapid rehousing, certainly happy to see that the funding is being allocated for that and the emergency assistance programs. At the May meeting, I requested that staff to look into a property that could be used as transitional housing for reentry clients, and that the Office of Diversion and Reentry Services could manage. And I remember also Supervisor Chavez made additional requests to look at our overall plan to end homelessness and to identify these type of gaps. And I've noticed that in the report on the item stating that it's currently in progress, and was wondering when we might be able to hear a report back on that issue.
Thank you, Supervisor Lee. The off-agenda report should be ready tonight or tomorrow, so we could send that out. Just generally, our housing programs for justice-involved persons or for any persons are primarily administered through the Office of Supportive Housing, and in some cases, especially for like jail diversion programs, through the Behavioral Health Services Department. Both departments and county administration ensure that we have the full continuum of services from shelter to prevention to permanent housing. We, of course, are always pursuing opportunities to create new beds or new housing, that effort is primarily through, at least for fiscal '24, going to be through our behavioral health bridge housing program, and then some other grants that we receive from the state. So we'll be using those funds to pursue opportunities as they come up.
Okay, thank you. I have a question on item 26. Should I talk about now or wait?
Not quite yet.
Okay, all right. Thank you, Key.
We're going to go next to Supervisor Chavez on 14.
Yeah, thank you. This is more of a general question, and I'm really, frankly, excited, and I'm looking forward to the report regarding housing. And that is on items such as item 14B, and this is the funding for African ancestry children for after-school programming, and item D. There are these continual one-time contributions, and I think it's really hard for the organizations to plan, and two, we end up having the same conversation about a small handful of organizations every couple of years or every 1 year or 2 years. And so what I would just like to request is that as part of our budget process, and I'm going to raise this in another area, that we identify which, in fact, are the programs that we, when the board requests them to be multi-year, that we better understand what we need to do to make them multi-year versus one time in nature. So I'm just pulling those two out, and I don't actually expect unless you have a response right now. There are some other ones where I'm nervous that the one-time strategy may actually impede our ability to get the work done. I'm not sure that's the case in either of these two, either with B or D. That hasn't been made, no one's talked to me about that, but just a query about how we proceed.
Well, I can give you a quick answer, and we can certainly come back with more details. But as I mentioned at the beginning of the meeting, we had to use one-time funds to balance this year to the tune of about 40 million. And so when we look at projects that can get started with one-time funds, we try to focus on those rather than, projects that are within the department or linked to some other service or, those kinds of things. So a contribution to Special Olympics and a contribution to the African Ancestry Program we thought were appropriate for using the one-time plugs. That doesn't mean that we don't want it to be ongoing, but we just needed to balance the budget for this year.
One request that I would make as part of today's budget action is that at the end of the process, and this may make sense to have come back in August or September, those organizations that we anticipate trying to do multi-year funding for, so that, again, it goes into the process early in the year and not at the end of the year. Because I understand what you're saying, because some of these, in fact, I think I raised one with you where we didn't know that the contract ended, and I'm not sure whose purview it was in, so I understand that challenge. But I would say through the president of the board that if we can track those that we think are multi-year and have that come back in the August-September timeframe would be helpful in terms of next year's budget process. Thank you.
I'm going to just make a comment about that as well, because I appreciate the effort and intention there. And I also know that we had an issue with a number of referrals that predated, I think, all of us, that had unwittingly gone on in perpetuity. They weren't created with any deadline, so they just had been funded year after year. We have this year addressed that. I like putting things that we know are going to happen every year into the base budget, such as Special Olympics, but I want to make sure that there is still some kind of evaluation or check-in each year to know, are you spending the money as promised? Do you actually still need the money? And whatever else we need for accountability, so we don't let the next board get into a situation where they wonder why we funded something
And
for
let
a
me
decade.
be clear too, my request, I actually think 3 years is a really good measure. There's sometimes we have to do them longer, sometimes shorter, but I'm not even recommending that. And really, the reason I'm being purposefully ambiguous is I think the staff should come back to us with a procurement appropriate, how we're looking at benchmarks, what department do they get embedded in so they actually get reviewed, and then what is the appropriate length of time that the board believes or the staff wants to recommend that we invest, and then under what circumstances is there an RFP or an RFQ for the service that gets provided, because we've decided it's a priority. So I really want to let staff come back to us, which is why I'm not making a recommendation for any of them today that we change the budget, because I actually think that's really something the staff should come back and recommend to us. There will be an exception in one area, but it has more to do with what I'm nervous about relative to an overall policy objective. But yes, absolutely.
Thank you. Anything else on 14? We're going to go to item 15 right now, the Office of the County Executive Budget.
And item number 15 is simply to consider all those recommended adjustments and ask the board to consider adopting or approving the recommended budget for the county executive as adjusted and referring the item for final approval on June 15th.
And this was pulled, I think, by Supervisor Arenas?
I think I spoke already on.
What number was it, Susan? I'm sorry, I distracted her.
That's all right, item 15.
15, thank you.
Yes, I think I did 14, 15, but I really meant only 14. I apologize.
Not a problem.
So
All
we
right,
can skip
then
over that.
Well, actually, can I raise one issue here?
Of course.
And colleagues, I'm only raising this because the Office of Supportive Housing is part of this part of the budget, and really this is for all of my colleagues. I think I raised that there's a regional ballot measure that's being considered for housing, and I want to make sure that the board gets an opportunity to get a presentation on the measure, because it has as one of the components of it, it suggests that 80% of all revenue generated would return to source and 20% would go into a regional pot. And for Santa Clara County, between the city of San Jose and the county of Santa Clara, that pot could be anywhere from $250 million to $400 million that then becomes part of a regional application process. And our pipeline is so rich that I want to make sure that we have a discussion about that with our Office of Supportive Housing. It has a huge implication for the pipeline and for services and any number of other areas. So I'm just raising that today because what I'm really hoping is that by August, we have a discussion with the board about where that is going in process, because it has so much implication for funding in the future.
And yes, I strongly agree. And I also think we need to bring in the City of San Jose delegation that sits on ABAG. Otto and I are part of it from the county. I think there are 4 or 5 from the city. And we're not a quorum, so the
That's a
7 of
great
us should
idea.
be able to discuss this together. And I think that would be a strong approach.
Yeah, and I'll just add that I sit on the MTC board, which is the board that will ultimately make a decision on this, but also on the Bay Area Housing Finance Authority Board, and myself, Margaret Abekoga, and Mayor Mahan all serve on the MTC board, and I think Margaret and I are the only ones on the other board. So I think all of those are good ideas, and we ought to think about the best forum so that we can bring in the region. Yeah,
Great.
Thank you.
Yeah, thank you. Items, Supervisor Lee, go right ahead.
Yes, actually, I was going to ask about item 21. If I forgot to mention earlier, I just wanted to make sure we added there regarding the registrar of voters budget there.
Why don't you do that right now?
Yeah.
Because we're then up to 24. So
Correct.
21, Registrar of Voters budget, Greg.
Right. So I have no concern based on the current budget. My only concern really is just to be in case, given how the political rhetoric has been regarding elections and the integrity of elections. I just want to make sure that there's sufficient funding to provide outreach and also potential necessary additional security to protect poll workers and the like, given the rhetoric and with the recent indictment of a former president and how that might potentially engage in more reactive extremist violence or disruption. I just want to make sure that our registrar of voters is ready, able, and for this type of contingencies. Thank you.
Thank you for the question. Shannon Boucher, Registrar of Voters. Yes, the county has been working with us collaboratively, the administration, on our current security needs. And if there are additional needs that come up before the election, I've been told I can talk and discuss with my OBA analyst.
Okay, thank you.
Supervisor Chavez.
So thank you very much. I appreciate that. I was going to go to another subject real quick, and that is for technology services. And they may have left. I don't know if they're still in the room. But, you know, we're doing a countywide new website program, and I don't know if your offices have been alerted that so that we needed between 50 and 150 hours to build a new website. And what I was wondering is TSS given the resources to actually assign somebody to do that, or to hire folks who have a special skill in building websites so that departments aren't relying on themselves like our offices, unless you all have people who and it's not that I don't trust my staff, but websites seem scary to me. So is that included in the budget so that there's flexibility to bring on folks to help us make that transition?
Yes.
Dr. Smith.
We have allocated appropriate resources for the implementation of the new website.
Well, let me press on that. Go ahead. But the board?
The board offices, how do I say this?
Just say it.
Have more discretion in how their website looks than the other parts of the organization.
Here's actually what the challenge is that TSS has informed us that it will take one of our staff people to between 50 and 125 hours to rebuild our office websites. And that is actually a lot of time, and especially for offices as small as ours, to dedicate one person to just do that. And so the reason I was asking the resource question is whether or not our offices were going to be resourced so that we could have somebody do that, because I couldn't figure out who I could take off of something.
I think you got erroneous information, and we'll straighten that out.
Okie dokie pokey. Let's make sure we straighten it out before we vote on the final budget, because I want to make sure our offices have the resources they need. All right, thank you.
Just for clarification, was the request related to the content or to programming of the website? Just so we understand, because
The way it appeared to our office after getting briefed was that it was really kind of a combination of both. And even if it was content, because what the challenge is, we can't transfer the content easily to this new website. So what I would just say is that and not just for our offices, but any department that's small enough that they count 50 hours as significant time to an activity, I want to make sure they're properly resourced to either bring in help. And frankly, look, TSS is going to be doing this for the whole county. I get it. Like, I don't want to give them one more task. I just want to make sure we're resourced enough to be able to be part of the program. So that may be our office budget. It may be in TSS's budget or the clerk's budget. I just want to make sure that if we need to have somebody transfer information and build out our websites, that we have the capacity to do that without stopping us from doing something else that's significant in our offices.
Yeah, we'll fix it on the inside.
All right, well, I'm looking forward to the fix. Thank you.
No, nothing. Thank you. So, as Travis, actually, I have a follow-up question. Thanks for asking that. We've been discussing this, actually, I remember when your predecessor, Greta, when I spoke with Ms. Marquez regarding the need to have language accessibility on our county websites and how we are going to make it more accessible. I mean, certainly during COVID, we've been doing a very good job of making our websites on COVID-related information and multilingual. So I want to see if we get a follow-up on, since we're talking about websites, how we are doing on that respect.
Well, I'll speak to it in a couple ways, and then I'm happy to talk to bring back more information if there's additional specifics that you'd like. First, coming out of our experience in COVID, we've invested in creating a really wonderful language access team in the Office of the County Executive, and that team is really designed to do the sort of very high-level translation and attention to detail on translation that we were able to do for really time-sensitive, high community impact information like what we needed to push out during COVID. And they're doing a lot of different work with a lot of different departments, both in terms of content that would appear on websites, but also just more generally. And that's a function that we're going to continue to invest in and develop. There's also a lot of emerging technology that I'm sure members of the board are aware of that as part of some of the anticipated AI transformation that's happening with more effective, seamless, rapid, web-based translation services that are continuing to improve that for some types of content are appropriate. So really, I think as an overarching response to your question, we're going to need to, over the coming years, really strategize and create protocols around what are the types of content that we need to translate with an extremely high level of precision, fidelity, and local focus in terms of just even the types of language used here, as opposed to, an example used that I can't personally speak to, not being a Vietnamese speaker myself, but an example that's often used that I think resonates for Vietnamese speakers here is the fact that Vietnamese translations for Vietnam don't look exactly the same as the way you would translate into Vietnamese for the community in San Jose. So that's an example of where some of what might be web-based or automated tools that might translate into Vietnamese for Vietnamese speakers in Vietnam aren't the ones that we might want to use here. So trying to figure out which tools to use for which portions of our web content to make sure that we can create the best possible language access is definitely a policy priority for administration. We know it's a super high policy priority for the board. And I don't know if there's anyone here who might want to offer a few more details on that, but it's something that we'll be excited to report out on as we continue to improve our web accessibility.
Yes, thank you so much, Greta, for that very clear explanation of what we're doing. I mean, certainly I have used, for example, Google Translate, which is basically a type of AI to translate, from, say, English and Spanish. For example, I've used it frequently, whether it's conversation or on documents even. And I certainly do think that we should make the increasing accessibility as the goal. In other words, let's not make perfect being the enemy of good. So let's get it out there. Let's use it right now. So even the website may be only 95% accurate. Using AI will certainly be better than not having it available at all. So that it will be easier for folks to get. I mean, we certainly put disclaimers saying that, hey, this is being translated by AI. Therefore, some of the contents might not be all accurate. And some type of disclaimer, I'm sure our county council would be able to help us draft on each pages. But ultimately, I think it's important to make sure that's being accepted. And once you use that, you could do it not just for the 5 main languages we knew. We could practically do it in so many dozens of languages as well, and at a fairly low cost, I believe. So I just want to make sure that we could get that implemented sooner than later. Thank you.
Thank you. Moving, the next one is item 24. And 24 and 25 were mine. This is county comms. And Greg, I'm just going to offer some direction, and I think this will be the beginning of a motion for this chunk. I'd like to have quarterly reports come to FGOC on county comms staffing and call times. I did see the swap out that the department undertook to achieve some savings that were required. I understand there's also been some progress over the last several months with the new job classification and procedural updates. But I think that ongoing updates on department performance metrics and operational priorities would be helpful and should be included in the requested quarterly reports. I think all of us have expressed urgency around wanting to support the build out of this department. So we'll look for a second on that, please. Thank you very much. So that's items 24 and 25. Any other supervisors? Supervisor Chavez, 24, 25?
No, I was actually going to 27.
Okay, well, we have to go to 26 first.
Okay.
Supervisor,
Me.
Supervisor Arenas, 26.
Thank you. This is a really quick question about this is 2060, the demolition of the old animal services facility. And so I know in order for us to save money this year, we're not going to do that. We're not going to demolish it, but what are the next steps for that facility? Are we including this cost into our next year's budget?
Yeah, the proposal here is to defer funding for 1 year and aiming for FY 24-25. And it is a measure to help rebalance the budget.
Okay, thank you.
Supervisor Lee.
Thank you. Talking on 26, specifically in this case relating to the energy efficiency. So during May, the FGOC meeting, I've asked the administration to look for funding for phase 2 of the energy audits effort at O'Connor, St. Louis, and St. Clara Valley Medical Center, and request the report comes back at the June meeting. We've done some research, and it turns out that staff will need more time to find a fund for this efforts and requested the report be moved to October. Instead, I'm happy to provide the extension and hear it at that time at the FGOC meeting. During that report, Supervisor Ellenberg and I heard back in May, the presentation noted that the county has identified over $41 million in potential savings, $41 million in potential savings if the county were to implement these energy efficiency measures across the 3 hospital campus. And most of these savings would stem from implementing the LED lighting, HVAC, along with like chiller, boiler controls, and pump upgrades. So this is one of those instances where clearly we have to spend money upfront in order to save money down the line. And it's green not just for the environment, but green for our pocketbook as well. And so we need to identify financing options. I would like to keep the administration accountable in making sure that this happens in a timely manner so that the work does not get delayed any further. And I would like to request the administration comes back during the mid-year budget review, identify funding sources to help finance to complete the phase 2 of this type of a project. Thank you.
Does that need a
Will do.
response? Okay.
Just a little bit of backup. The major expenditure problem is the cooler, and we're focusing on that first, and then we'll move on to the others. But we'll give you a more thorough report.
Thank you. Anything else on 26? No, we are moving to item 27.
Thank you. I got my question answered, actually. Thanks.
Okay, anything else on 27? Okay, so I've made a motion regarding 24 and 25, but I will amend that to be a motion to approve as needed any of the items between 8 and 32, inclusive of the direction by myself and any of my colleagues. May I have a second? You seconded it already. Thank you. And we've had...
I'm sorry, President Ellenberg. I'm trying to figure this out. This is up to item
32.
Correct. Okay.
All right. Let's vote.
Supervisor Arenas?
Yes.
Supervisor Chavez?
Yes.
Supervisor Simidian? Vice President Lee?
Aye.
President Ellenberg?
Yes.
Passes unanimously.
All right, colleagues, it is 5 o'clock. We have I don't know how much time this will take, so I just want to note that if we are here at 6, we will break. Dinner will be available for us, and we will reconvene at 6:30. Of course, if we are finished by that time, we will move on with our days. This section is the Health and Hospital Departments. It's items 33 through 43. We will hear public comment first, and then go down the line to request items to be pulled from this final chunk. So for members of the public, now is the opportunity to speak on public comment on items 33 through 43. Curtis, how's it looking?
Let me read our Levine Act notice, and then I'll
Please do
let you know.
that.
Item numbers 33 and 39 are subject to the Levine Act. Any party or their agents must disclose on the record a contribution of more than $250 made to a board member, as described on page 3 of the agenda. Participants who have a financial interest and their agents are requested to make a similar disclosure.
Supervisor Simidian?
Thank you, Madam President. Once again, we've been advised in this instance that items 33 and 39 on today's agenda may in fact be subject to the Levine Act, as indicated in the language on our published agenda. We've also been advised that pursuant to state law, any party or their agents must disclose on the record a contribution of more than $250 made to a board member, as described on page 3 of our agenda. I want to ask at this time that if any party or agent has made such a contribution, that they disclose that contribution immediately so that I may promptly recuse myself. I would also ask that if any participant in these proceedings, as defined by the Levine Act, has made such a contribution, that they disclose that contribution immediately so that I may properly recuse myself. And I would also ask that if any employee of the county council's office or the clerk of the board's office or any other member of county staff or any member of the public knows of any reason I should recuse myself under the Levine Act, that they please disclose that information immediately so that I can promptly recuse myself. And finally, Madam President, while it is, of course, a matter of public record, I would like to note once again that since January 1st of 2023, when Senate Bill 1439 took effect and amended the Levine Act, I have in fact received various campaign contributions, which have, of course, been reported in full as required by law. All such reports are, of course, public, and I would ask that if anyone has any reason to believe that any of those contributions were unlawfully made, that they advise me of that immediately so that I may correct the situation and ensure that contributions that are not permitted are not subsequently given or received. Finally, let me just exhort any and all potential campaign contributors, please make no contribution which violates Senate Bill 1439, the Levine Act, or any other provision of the law. Thank you.
Thank you. My own requests for this section are that I would like to hear items 39 and 40K.
President Ellenberg, would you like to take your speakers?
Curtis, how would I manage without you? Thank you very, very much.
We have 2 speakers in chambers. We currently have no speakers on Zoom. Our speakers in chambers are Julia Barba and Ann Erisman. Please come up to the podium.
Thank you.
It looks like we have 1 speaker on Zoom right now.
Okay, we'll let the folks know on Zoom if you're intending to speak on items 33 to 43. Now is the time to raise your virtual hand. The queue will remain open until the first Zoom speaker begins speaking. Thank you. Welcome.
Director at Community Health Partnership, where I direct our enrollment and health education programs. I speak in support of proposed funding for community health center-based enrollment counselors to undertake the influx of community members needing Medi-Cal redetermination and enrollment due to the new Medi-Cal expansions and PCAP expansions to 650% FPL. We appreciate the county's executive's recommendation for 1-year funding. However, we request your support for a 2-year minimum grant. 3 years would be best, to ensure that our community health centers increase the rate of Medi-Cal members from 60% to 70% over a 2-year period. A 2-year grant would allow us to recruit, train, certify, and deploy a high-quality and effective enrollment team to meet the incoming need of enrollment services. A 2-year grant acknowledges that the enrollment needs of all eligible individuals cannot happen in 1 year. Our strategy includes in-reach to 67,000 current clinic Medi-Cal patients for redetermination, outreach to an additional 3,300 new Medi-Cal and PCAP eligible individuals, and education regarding healthcare access, patient rights, and public charge. Our proposal allows the county to draw down more federal and state funding, lessening the expense to the general fund. For example, one Medi-Cal member generates an average of $5,000 in annual revenue. 1,000 new members could bring an average of $5 million annually, with CHP's proposal only costing $3.78 million for the full 3 years. We believe that a multi-year investment in enrollment teams would help accelerate getting people into the correct health coverage program and allow quicker access to health care, resulting in improved health outcomes. Thank you.
Hello, everyone. I'm Ann Erzman. I'm the Interim Executive Director for CHAC, the Community Health Awareness Council that's headquartered in Mountain View. I'm speaking on item 39D. I want to express my gratitude to the Board of Supervisors for your unanimous approval of Supervisor Simidian and Supervisor Lee's referral to support CHAC, and also to the County Executive's Office for your recommendation of $1 million for CHAC to support our services over the coming year. If you approve this investment, you're going to be meeting two of your goals. One, most importantly, is workforce development. I've been hearing over and over during this hearing the shortage you have in the mental health field. CHAC trains over 60 mental health clinicians every year. We've been doing this for the last 20 years, and we have a 50-year history of providing services. The other goal that we will support for you is providing community-based care for those who are most in need and lower income. We got to go up the pipeline as far as we can with prevention and direct supports, and doing that with a community-based organization that has trust and relationships with the school districts, with community members, is a really solid investment. So thank you for your support.
Thank you. Speakers on Zoom?
All right, we have 3 speakers on Zoom.
When the first speaker begins speaking, we'll close the Zoom queue, so if anyone has yet to raise your virtual hand, now is the moment to do so.
All right, our first speaker is Maribel Montanez. I am unmuting you. Please accept the unmute. You'll have 2 minutes to speak.
Good evening. My name is Maribel Montanez with Gardner Health Services. Thank you for considering item 33 and specifically 33I and 33R. Today, I want to focus on 33R, which supports the expansion of health insurance enrollment activities as we prepare for the state's Medi-Cal expansion in January of 2024, and also the county's PCAP expansion in the very near future. One minor change that I would recommend is to amend this budget item to multi-year funding for a total of 3 years to sustain these enrollment activities. I appreciate your support and look forward to this item's final approval on June 15th. Thank you.
Thank you. Our next speaker is Leticia B. Hernandez. I am unmuting you. Please accept the unmute. You will have 2 minutes to speak.
Hi, good evening, everyone. My name is Leticia Barrera, and I am the Program Manager for Enrollment Services at AACI, a member of also Community Health Partnership. I speak in support of the county's executive proposed funding for 15 enrollment counselors and 1 program coordinator. However, ACI strongly believes that there needs to be at least 2 and preferably 3 3-year commitment to the program to be sure that as many people can be enrolled in coverage as possible. ACI's enrollment counselors assist clients with the complex and confusing process of signing up for health coverage. Many of our clients are non-English speakers and do not have experience completing applications and compiling supporting documents. Our counselors guide clients through every stage of the process to make sure they can get the right coverage without getting unnecessarily rejected. Please consider making this a multi-year commitment to funding for the enrollment counselor program. We believe the need will extend beyond 1 year. Thank you.
Thank you. Our next speaker is a phone number ending in 500. I'm unmuting you. Please accept the unmute. You will have 2 minutes to speak.
Good afternoon. My name is Marisela Carrillo, and I'm an enrollment counselor for Garner Health Services, a member of Community Health Partnership too. I speak in the support of the county executive's proposal funding for 15 enrollment counselors and 1 program coordinator to enroll new and recertified existing members into pickup and medical programs. We really appreciate the 1-year funding. We at Garner strongly believe that there needs to be at least 2 and preferably 3-year commitment to the program, just to be sure that as many people can be enrolled into coverage as possible. As enrollment counselor for more than 16 years, I know that the process can be confusing for some people, especially with some barriers like literacy, language, access to technology. That can make the process very difficult, if not, I can tell, impossible for some of them. I just want to thank you for your time and consideration, and I would like to ask you to please, if you can, extend our commitment for 3 years and for our enrollment counselors program to continue assisting people into the medical and have our community be enrolled into health insurance processes. Thank you.
Thank you. That concludes public comment.
Thank you very much. Again, we are on the third and final chunk of items to be heard today, items 33 through 43 that pertain to the health and hospital departments. My own requests are to hear items 39 and 40. Those are the Santa Clara Valley healthcare items together. And I will look down for lights. Supervisor Chavez, what items would you like to hear?
Thank you. I'm going to ask questions on 33E, 33K, 33O, and 33R.
33E, K, O, and R. Any other items? Thank you. Supervisor Lee.
On 34. Thank you.
Excuse me?
34.
34. Supervisor Arenas.
33, did we already say R?
Yes.
Okay. All right. Perfect.
Supervisor Simidian? All right. Then let's begin with item 33, and the subsections are E, K, O, and R.
Thank you. I don't need a presentation unless you do. Anybody? No. Okay.
ahead.
Thank you. First on E, I just wanted to say just how excited I am to see the Universal Development Screening Initiative expanding throughout the county. I think that's just wonderful, and I didn't want to miss an opportunity to say yay. On item K, this is a transfer from the EMS trust to the to the hospital budget to strengthen the emergency management program. And I wondered if staff could just give a little bit of background on K.
Paul could give you some background. Paul
Great.
Lorenz,
Thank you.
CEO of the hospital and clinics.
Thank you, Supervisor Chavez. Good evening. So first of all, one of the things that we've been doing since the COVID pandemic experience is really beefing up our capacity to respond to emergencies. We're speaking of both natural and man-made disasters. So our team has identified a number of different areas where we can improve our infrastructure, capacity around technology and equipment, but also in regards to our policies and procedures relative to a response. So the ask is to reinforce our ability to respond to both man-made and natural disasters.
Could you give an example of what that means?
Well, so first of all, as you well know, working with the Public Health Department, we clearly, as a healthcare system, have to respond to any type of related disasters around potential outbreaks as a healthcare system. That's one. Other areas include natural disasters relative to earthquakes, et cetera. And the other area that we're also focused on is around man-made related incidents, including bioterrorism, et cetera.
And so, Paul, is this for training or is it for equipment or both?
It's equipment, technology, as well as training.
Thank you. And that's very helpful and it sounds like a great use of those resources. And then I'm going to move over then to item O, and if my colleagues are okay with that. And that is the, this actually goes into the category of concerns that I have about just doing year-to-year funding. And I appreciate the point, Dr. Smith. I think this reinforces your point about being able to draw down on one-time dollars. But this is the screening with Healthier Kids Foundation. And again, this goes on the list of things I would just like to see us have a discussion about whether or not it should be a longer-term contract in our budget versus a one-year contract. So President Ellenberg, when we have the discussion about contracts, that's one that I would like us to take a look at. Item R, and this is the issue raised by a number of speakers relative to the Community Health Partnership. And since this is general fund, I'm a little confused about why this is a one-year contract versus 3 years, given the number of people that we're obligated to recommit to health insurance.
Let me try to explain my thinking on this one. Certainly sounds like it'll be a great program, but we've never done it before. And it involves working with CalSAWS, which is a totally new system which our eligibility workers are being trained upon. It also involves working with our eligibility workers to some extent and potentially changing their type of work. And I felt that since we didn't have experience with it going on right now, since we had a budget deficit, since we were in the middle of negotiations with SEIU, that it probably would be better structured as a one-year contract to see how it works out rather than committing right away to 3. But obviously the board can do whatever they want. I mean, I would expect that it'll work well, and I would expect that next year you would continue it. But I didn't want to preempt that decision, particularly with all the changes going on in social services and SEIU and Medi-Cal. So that was my thinking, but you can certainly reverse my thinking.
So thank you for that, Dr. Smith. The concern I have is that if we're concerned about something relative to it being a pilot program, then my expectation would be that even if we did a 3-year planned investment, that we would have the flexibility of terminating any contract for lack of performance, or even having the capacity to restructure the contract based on what we learn with the pilot. My concern with the way it's structured now is that, one, we're dealing with organizations and nonprofit partners that have been helping us sign folks up already as part of the, not just, for a number of them, helping us with children's health insurance and adults already. And I do appreciate the point you raised about I didn't realize that there were going to be significant changes relative to the state and having the retraining. I think that's really helpful to know. That all said, I imagine that our goal is to make sure that they can bring staff on that can help us accomplish this. I think that's more difficult if it's a one-year contract. And again, my expectation would be that we would be able to embed in both performance metrics, but also if the contract's not working, have the ability to end the contract. So, but I understand the point you're raising. I would just say, colleagues, that I think this is one of those areas where I think it's really important that we lean in to make the investment that we're trying to accomplish, because we know we have a lot of folks who are, frankly, I think we're going to, I'm nervous that we're going to not sign up enough people and have a negative impact on our overall funding. And I also recognize, and I just want to say this, Dr. Smith, because you raise a really good point, the partnership between the role that these folks play versus our eligibility workers, because ultimately an eligibility worker still needs to be able to turn in the application. So if these are trusted partners that we've seen perform in the past in terms of making sure those applications are robustly filled out so that we're really able to move them over to our eligibility workers, then I would say, goodness, we should probably do multi-year. But if what you're saying is the work is so different, then I would want to understand how, so again, the board could make a decision about how to proceed.
Yeah, I probably shouldn't say too much more about negotiations other than to say that we're in the process of discussing potential changes in the function of eligibility workers. But to maybe make a suggestion, if the rest of the board thinks it's a great idea, rather than recommending an allocation out of this year's budget for the next 3 years, maybe a contract that's 3 years in length, realizing you have to allocate new money every year for that contract.
That would actually be my preference, and exactly the way you just said it, Dr. Smith.
Okay.
Thank you.
We can do that.
Supervisor Arenas.
Thank you. I'm going to speak on item R. Okay. I know that for my part of the district, I know that we will be very welcoming of folks enrolling undocumented residents, but that won't be until the beginning of this year. And so with the point that Supervisor Chavez was making in terms of making it a longer period of time, this is something also I was hoping to advocate. I'm glad that you all came to that conclusion, because starting January, we'd only have 6 months left in this fiscal year, right? And so then there's that uncertainty of employees who are working through a CBO and not knowing whether they have a job beyond June 30th. And so I hope that as a board that we will continue the funding every year for the next 3 years. But I think there's a lot of value in having it multi-year. We can figure out the monies every year that passes as we move forward. But I think it was just absolutely important for us to have not just the folks who are enrolling our community currently, but the ones that we expect that are not qualified just yet. And there's a lot of work that goes, I think, along with creating a sense of credibility in our community. And I hope that we can begin that ahead of time. And so this is one of the questions I also have is, how are we going to begin to inform our community about the new criteria beginning January of next year?
I don't know if Social Services is here to give more details, but we've already been doing a public campaign and getting in contact with individuals who we think will qualify directly and individuals who are already in the system to notify them that they have to reapply, and then the same process is anticipated to be used for January when there's more access to undocumented individuals.
Okay, well, yes, and that's what I meant was for our undocumented, especially I was thinking in South County.
Right.
Those communities are slightly different than in San Jose, right? So they're a lot more migratory than what we see in San Jose, and so I'm hoping to hear a lot more details about that offline.
Yeah, we can do that.
gearing up for it, because we can't start, right, January. You all know this because you're carrying on the campaign now, but what works for San Jose is not necessarily going to work for Gilroy or Morgan Hill.
Right.
All right, so I'd love to hear more offline at that, and thank you, Supervisor Chavez, for that solution, and actually Dr. Smith for offering that solution to some of the concerns we had about this. And I think those are my comments. Thank you.
Thank you. Item 34, the Santa Clara Valley Healthcare budget is next. And that was Supervisor Lee.
Actually, my concerns were addressed by Dr. Smith's comments and Supervisor's question about the enrollment counselors on item 33, so I don't have any more questions yet. Thank you.
All right. Items 39 and 40 were mine. Those are the revised recommendations in the Behavioral Health Services Department, 39, and then 40 is the Behavioral Health Services Department budget. And I do see a number of changes since the May workshops. I'm comfortable with the additions in trust and CHAC and the designation of funds to support the IGT payments. I know my colleagues are aware of the need to maintain our expanded efforts in behavioral health, including in connection with our local emergency declaration and in light of the significant behavioral health legislation currently proposed at the state level in both LPS and MHSA reform. Through CSAC and with our county IGR team, we've been working intentionally and deliberately to elevate our county's profile and advocacy on these issues, not only for the purposes of influencing policy development, but as well to demonstrate the leadership that Santa Clara County has already exhibited in expanding behavioral health services. In this revised budget, the overall behavioral health budget is increasing, but our local general fund investment is recommended to be reduced by $15.3 million compared to last year's adopted budget. And my concern is that deliberately reducing our local investment at the same time that we're asking the state to increase theirs feels incongruent to me. I know that we consider some state realignment funds to be flexible, but ultimately those dollars originate with the state. And I feel that in order to continue to advocate effectively, we really need to continue to walk the walk through this budget on our local investment. I'm not focusing here on specific cuts that should be restored, but rather a concern with an overall decrease in our general fund investment in behavioral health compared to last year's level of investment. This might involve revisiting proposals made by Harvey Rose, including the $12.4 million that we redirected under the motion made by Supervisor Simidian under item 6 earlier, or digging deeper into the capital budget. But just given the uncertainty with MHSA reform, CalAIM payment reform for the county and our contracted providers, and substance use treatment projects still in development for next year, it may make sense to create a one-time reserve for behavioral health for further consideration next year on our ongoing level of investment. So I'd like to direct administration to return to the board tomorrow with options to address this concern alongside item 17 in the Harvey Rose grid that was directed by Supervisor Simidian under agenda item 5.
Tomorrow will be tight. That gives us zero time. How about Thursday?
Thursday would be delightful.
Okay. I'd like to explain what
Sure.
the thinking was here, just to make sure that everybody in the public understands what we're recommending. We're actually expanding the services provided by behavioral health by using some realignment and some MHSA funds to pay for some of the current services that are being paid for by general fund, thereby decreasing this, what would in the hospital be called a subsidy. So it doesn't decrease services, it actually increases services. But we can certainly go back and look and come back to the board with a report on Thursday to make sure that it's clear that we're committed to improving and increasing the level of services in behavioral health.
Thank you. I do appreciate that. And I'm trying not to be directive, but to really understand how we can talk about our investment and the seriousness with which I know Santa Clara County is approaching the mental health crisis, and I want it to be equally obvious, truly up and down the state. So thank you for that.
May I follow
Supervisor
up on that?
Chavez,
Yeah,
please.
thank you, Supervisor Ellenberger, President Ellenberg, for catching that. And I think just one other point to add is that I'm really interested in how the state's changes in insurance impact this too, because it's hard to know. Back to the point that President Ellenberg raised, it feels like we're growing our system pretty rapidly. And so just understanding the new sources of funds and where they're falling in would be really helpful.
Yeah, it's changing dramatically, and as you know, about 90% of the actual clinical work that is done in the county is done in our collaboration with CBOs. We have county employees working in the emergency psych facility and in some clinics, and also in the Barbara Aronson Pavilion for doing inpatient work. But the outpatient structure is, for the most part, done by the CBOs. And so we're trying to expand that service, and we expect that the changes in funding from the state level will, although unpredictable at this point, will have positive effects on some and negative effects on others. That's why we've set up a system where we're going to intervene if there's a negative effect to prevent losing access. But there are a lot of moving parts going on, so we'll look at the budget and see if we can make things balance in a different way.
Thank you. Are there other comments on any other items in our last chunk today? If not, may I have?
Could I make a comment?
Of course.
An issue that wasn't brought up was the contribution to SHAC, which is Community Health Awareness Council. I just want to clarify that this is a contribution in order to sustain a clinic which does remarkable care for children in schools and is doing a great job, but up until now has not been qualified for Medi-Cal, and we think that if they're qualified with Medi-Cal, that'll stabilize their funding. They also provide a training opportunity for clinical experts, which will actually improve our ability to find and hire and recruit clinicians throughout the county. And we think it's a great investment for the county, and that's why we're suggesting this $1 million in order to give us time to be able to do the changes that need to be done in order to get them Medi-Cal qualified. So I just wanted to point out that there's multiple reasons for this being a great investment.
Thank you for that. Do we have, so the direction that I gave with regard to 39 and 40, I'll make as the motion for this chunk. Was there other direction?
Yes,
That came?
and I'll second that with an inclusion of remedying item R to a multi-year contract as the staff sees fit to do that, however is appropriate. Part of that, it might be as part of this budget or have to happen in August. I recognize that. And then I think then it was just the overall report back on those that are one-time and how to make them
Right.
multiple year here as well. in an appropriate way that aligns with our procurement policies.
Thank you very much. Is all of that clear? Let's vote on this motion, please, Curtis.
Supervisor Arenas.
Yes.
Supervisor Chavez.
Yes?
Supervisor Semidian.
Aye.
Vice President Lee.
Aye.
President Ellenberg.
Yes.
Passes unanimously.
Thank you very much. With that, we will recess to tomorrow, Tuesday, June 13th at 1:30 p.m.
Excuse me, Madam President. You have item number 44, consider items of concern and refer to administration.
I'm so sorry. Thank you very much. Item 44 is items of concern for referral to administration. Do my colleagues have additional items of concern for referral to administration? And before they offer any, do we need to take public comment on item 44?
Looks like we have one speaker on Zoom.
Let's do that.
All right, our speaker on Zoom is John Sweeney. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak.
Hi, my apologies, everyone. I'm meaning to speak on item 40, which I hope it's not too late to be heard on the record for. I'm speaking on behalf of the County Superintendent of Schools, Dr. Mary Ann Dewan, and I want to thank the board for including funding to address the student mental health crisis in the proposed behavioral health budget. In particular, the proposed $10 million for a school-based wellness center grant program. The Santa Clara County Office of Education is proud to be a partner in the countywide Student Mental Health Consortium and is thankful for the ongoing collaboration with the school districts in the county. As the RFA for the Student Wellness Center funding is developed, we strongly encourage the board to include technical assistance funding and allow consortiums of schools to apply. As we know from firsthand experience, launching a student wellness center that complies with education code can be very complicated, and building out Medi-Cal billing and fiscal sustainability plans for each school requires unique expertise in both school-based and managed care billing systems. The county office remains committed to partnering in this work and is happy to partner with the board on the RFA to identify ways to ensure that schools who receive this funding can successfully and quickly launch student wellness centers that meet the crisis needs of students. Thank you for your leadership, partnership, and commitment to expansion of school-based behavioral health services and wellness centers on school campuses.
Thank you. That concludes public comment.
Thank you very much. Are there items of concern and referral to administration in addition to what we have directed through the other items?
Thank you, colleagues. I have one item of referral and then one item for sunshine, and that is that I have one contractor that I feel falls into the bucket of work that we're doing with the African ancestry community that I'm going to be asking staff to take a look at, and it's called the 10,000 Degrees Program. So I'll forward that to staff just to get their feedback. But the second thing is that I will be making a referral on the 20s on our last day as directed by staff to look at rolling over the budget in my office, and wanted to alert anyone in case you wanted to do that rollover time would be on the 27th.
What does that mean?
What it
please?
means is any ending fund balance, putting it back into your office budget for the following year. So I just wanted to alert everybody, sunshine that.
Thank you for that. Supervisor Lee.
Actually, I have a question for Greg about that very question regarding the fund balance rollover. Is this something that we could request for all offices or individually?
It could. This question came up from Supervisor Chavez's office for, what would be the process if she wanted to come and make a request and the rest of the board agreed. And that would simply be, if there was the approval of the board to do it, we would come back for the rollover true-up, which we do with the controller's office usually in September after the books are closed, to see what the additional amount is. And potentially, if there's other board offices, that's something you guys could discuss, at that meeting. So that was our mechanical discussion of how to do it.
Okay, certainly I think that's a fine idea, and I think if we could do it for all our officers or whoever would like to just mention it, and certainly I think our office will be interested as well. Thank you.
Any other comments? I would want to understand, I mean, the pros are obvious. If there are any cons or compounding issues, I would just like to understand the full ramification. It doesn't have to be now if this is going to come back to the board.
Just one general comment.
Sure.
The budgets for the board offices is relatively small compared to departmental budgets. But for any budgetary savings from all the other departments, we estimate that and we count on that to balance next year's budget. That's that ending fund balance estimate that we balance to. So that would be the only note I think of importance is we do forecast what that savings is. It all gets used. It gets used to pay for next year's budgeted costs. So that's the only caveat I instinctively would want to share.
Sure, and understanding the amounts that we're talking about and whether board offices generally do have leftover amounts at the end, just as much data as you can provide us when we're ready to have the full conversation would be terrific.
Okay.
Thank you very much. Are there any other items today? We are now then going to recess to tomorrow, June 13th at 1:30 in the Board of Supervisors. Curtis, thank you always for clerking. Thank you especially today for partnering with me in managing this meeting. Appreciate you.